like as soon as you close out one, you gotta turn around, open up the next one. Yeah, yeah.
$10 million project. The team are paid half.
For the most part, okay. Yeah, yeah, no, well,
Right next
month
to
or so
Padre Island.
ago,
Well, they're building a natural gas liquefying.
shows have been going, the last 3 or 4 shows have been good. Problems,
Gas,
staffing, so
buy from Russia. I've never seen anything like it.
other than that, it's,
There's a couple thousand Caterpillars.
we still don't have enough.
Digging.
Okay, that's the only thing on the strategy.
Because they gotta put
Yeah, no
rebar in
problem.
and put these piers in, like every 25 feet. You can't have buildings on sand. You gotta have piers holding all this up.
Name, is that where kind of? That was Warner?
So you're saying,
No, I'm just saying, that,
Or?
yeah,
Yes.
pretty good. Everybody's adjusting.
Present.
Adjusting.
Sandra Femmer?
she's right here.
Doing pretty good.
Mary Glasscock? Constance Graff?
Here.
Subson. David Hardy?
We're actually making money because
Kevin?
the thing going off.
Did I say that?
Saving.
Kenobi.
Did you say Stephen?
Nadine, I'm not even gonna try to say your last name. I will save myself the embarrassment. Thomas Murphy. Donald Loomis. Rita Shaw.
Yep.
Did I get close with that one? Okay. Deborah.
I'm here.
Regina. Regina Tripp.
She is actually with us, but
I can't leave it because of this personal information. Okay. Joyce Wagner. Sonia White. And Dennis Wicks.
He's gonna be sitting here if he gets here.
Did you have one for me?
we'll send it to department.
Did she call your name?
No, because I,
You had to fill out the thing online. Oh, I didn't fill anything out.
I did, you don't
Okay.
have my name.
I was on vacation.
I have extra booklets for anybody that would like one. Okay.
You got Laura?
That's you, isn't it? No, that's,
No,
that's
that's
airport.
Dennis Reese, it's here. Yeah.
Is he here?
Okay.
He's supposed to be coming, but nobody's not here yet.
Joyce?
No, Sue.
So anybody else that
Sign up.
does not have one?
So you sent me that and
Ray, if something goes wrong, just.
I didn't know what to put it in.
Just start
I'm a loser. I was on vacation and she signed me up and she said, you're going to this. I said, okay, and then I was out. And she came back and I said, fill out.
I thought leaving 45 minutes early, I wouldn't be so rushed, and then I got in a car accident.
You did?
Yeah.
Well, you're doing really well. Are you okay?
I was not in an accident, I got behind
Oh, I
one.
thought you were in the
No, but my heart's pounding because I'm leaving late.
Yes.
Now, you've got a printout, you've got a printout for everybody on theirs,
Who
or,
registered, they have their own personalized benefits.
and so I can get that on my.
You can get one from my locker, or if you like, we can talk after this and I will hook you up.
Thank you.
Yeah,
Somebody comes in.
That'd be great. I'm gonna grab my
It used
glasses.
to be the style when I was in high
What
school.
do I get a month of ours? What do I get a month?
Yeah, over there, I'll take.
Dennis?
I think it's more on.
You showed me.
You got more than you know, but you just.
What?
I think this is the number here.
I got my glasses. Talking about.
Single allowance.
Oh, okay.
Is there no more?
What are you thinking about?
Good morning.
Morning.
I apologize for.
Is there no more booklets? It's
I gave them back to him at the back table.
Did you go there?
I'll get you one though.
2,000.
I'm sorry.
Let me show you what chops.
Thank you. Welcome. My name's Kathy Rolls. Thanks for inviting me to be here with you all today. A couple of things. So those of you who registered online have a benefit estimate. Throughout this presentation, you're going to see snapshots of different sections of that benefit estimate as we go through here. And if you open your booklet that you have in your folder, the first 2 pages is a sample estimate. So if you forget everything that you heard today, you go back to this booklet and it will explain what everything is on your benefit estimate for you. And my 2 favorite pages of this book that are not included in this presentation, however, is the very middle. It is a checklist for what to do, what steps to have in place as you near retirement. So as the book just naturally folds open, those middle 2 pages, it's a checklist. Can I? Here, that's it. These 2 right here. It says application process. It's right there in the very middle of your book. I like that one, but I'm an organized soul, and it helps me to have a checklist. I make lists all the time. So I just wanted to point out those pages before we got started. Okay, this is broken into 3 different sections with a little bit of break time in between each section. Those break times are a perfect time to ask questions, get up, move around, use the restroom if you need to, and I can still make my hour-and-a-half deadline for this presentation. So I feel like if we'll take a vote at that time, if you want the break, need the break, we'll absolutely take a couple minutes. If you want to just keep moving forward, I can do that too. If you have questions at any time, you don't have to raise your hand like you're in high school or whatever. Go ahead, let me know, and I'm happy to answer your questions as we go through. The 3 different sections, the first one is understanding that benefit estimate, timing your retirement, calculating your benefits, employee contributions. Section 2 is the longest, I think, because I tend to take the most time with this one. This is your payment options and the application process. To me, it's so important that you understand what your payment options are going to be, because once you select one and you receive your first payment, you can't change it. So that's why I really want everybody to understand what their options are. That last section is the fun stuff, talking about cost of living adjustments, working in retirement. And I say fun stuff, but, well, taxes have to be in there somewhere. We're just gonna say that for the benefit, okay? So that's the 3 sections that we have so far. So understanding your benefit estimate. Most of you have had one employer, St. Charles County. Some of you, however, have multiple employers. You have a paper clip on your benefit estimate that's in your folder if you have multiple loggers covered employment. The first page, if you have multiple employers, is what we call a comprehensive. This is your entire payment, all of your calculations added up. This is your combined benefit. If you just have the single employer, St. Charles County, then the very first page that you have is your demographic information. So if you have multiple employers, you can refer to the stapled pages. Okay, the stapled ones are your individual employer benefits, and the first page of those individual ones is the demographic information on there. And so it'll show you here on this. If you have multiple employers, it will list all of your employers at the top. And if you have member contributions from them, it'll list those as well. And then below that, it'll have the boxes that talk about your combined payment. So timing your retirement. And don't worry, there's snapshots of this benefit estimate. We're going to go through each part, and I'll explain each part as we get to it. The first part of your benefit estimate that I want to explain, if it looks a little different than what you anticipate, is that benefit effective date. Since I am not a benefit specialist, I'm an education and outreach specialist. Benefit specialists have a little more control over our computer system than what I do, because they're the ones who actually help calculate your official benefit. Okay? When I enter a benefit estimate and run one for you, I have to put the first day of a month as your benefit effective date. You get paid the first banking day of the month, but the effective date in our computer system when I run it has to be the first of a month. So if you gave me a date that was maybe your birthday or anniversary day, or just you want to work to the middle of the month and then the very next day you want your check, I had to change your effective date. So that's why if you put something different in the computer than what shows up on your estimate, that's why. So I either went to the beginning of that month or I moved it up to the first day of the next month, depending on what you gave me. So that's what that benefit effective date is, right there. That's the first day you would receive your benefit payment, first banking day of the month. Now that could be very different from, it says date of termination, that's the last day that you get paid for working. So sometimes you could, if you wanted to, work a few days into the month of the same month you get a benefit payment. So let's say you want to get paid for all of your vacation days. You're going to use your last bit of vacation as your last working days. So maybe your last working day, because you're getting vacation, or that's the last day you're there in office or on the job, is like the 3rd or the 4th of the month. You can still get your benefit payment on the first banking day of the month, if that makes sense to you. So this is basically that date of termination is the last day that you get paid for working. Now, when we run the benefit estimate, it will project out your service credit. So if your estimated retirement date, your benefit effective date is a year from now, it's going to add that year of service that you haven't worked yet. Our computers will calculate ahead your service and your age. So that's why you may look at your age and go, I'm not that old, but you will be on that effective date. So that's how the computer calculates that. So that's why the service credit doesn't match what you have right at this minute. It's calculated up to that benefit effective date. Does that make sense? Groovy. So to time your retirement, first of all, you have to be vested. I ran your benefit estimates, you're all good to go. Okay? Vested means you've got 5 years of loggers covered employment, 60 months. Okay? So that part you have. The second part that's important is reaching retirement eligibility age. That means for general employees, it's age 60. For police, fire, public safety, that's age 55. Now you can retire up to 5 years early. You can absolutely do that. But because we're stretching your benefit out longer, there's a reduction in your benefit to cover those extra years of retirement benefit payments that you'd be receiving. So it's 0.5% for every month early. I hate little bitty numbers like that. I like bigger, rounder numbers to help me visualize it better. It's basically 6% for every year early you retire. So if you're a general employee, you want to retire at age 59, you get a 6% reduction for that 1 year. If you do the full 5 years early, if you're a general employee retiring at age 55, police, fire, or public safety retiring at age 50, that's a 30% reduction in your benefit for that early retirement. Okay, but you have that option if you want to. So you have those retirement eligibility ages. So all of that is explaining basically a lot of that first page of your benefit estimate. Are we all good on that part? Okay, so calculating your benefit. Your benefit is based on a calculation. So St. Charles County chose that benefit multiplier for you, okay? And we multiply that by your final average monthly salary, and we multiply that by your service credit. Please don't be under the impression that you have to finish out an entire year to get a year's of service credit, because we calculate credit monthly. You can work 1.5 years, you can work 2 years, you can work 3.5 more years, however you want to do it. A year in 1 month. It doesn't matter because service credit is accrued monthly. So at the very bottom of this screen, we just have an example. It's a 1.5% multiplier. Like I said, I like round numbers. They're easier for me to calculate. $4,000 a month final average salary, 25 years of service. With that calculation, you would receive $1,500 a month every single month of retirement. This is guaranteed monthly income. It's not an account balance that decreases and goes to zero. You get this every single month when you pass away. It could potentially increase with those cost of living adjustments that I'll talk about at the very end. But the best part about this is knowing that you have this payment coming to you every single month in retirement. So the benefit program that is listed on your first page, that's the program St. Charles County has chosen for you. If you have multiple employers, each of their benefit programs will be listed next to their name. Now, I have here, we have different life programs, because some of you have multiple employers with different life programs. That means that that's that benefit multiplier times your years of service, and you can kind of figure out how much of your pre-retirement income you would have based on that. And so each of our multipliers, as they increase, your pre-retirement income percentage will increase. St. Charles County has a life and temporary program. What that means is you have a temporary benefit of 2% until age 25, and then at age 65 it drops to the base multiplier. They have an LT8 program, right, here in St. Charles County. That means that you have this 2% multiplier until age 65, and then at age 65 it goes to a 1.5% multiplier. If you have waited to retire until after age 65, you've missed the temporary portion of that benefit multiplier, and you'll just have that straight 1.5%. The reason I bring that up is because as I was running your benefit estimates, some of you didn't have a second. There are 3 columns for people under the age of 65. One is for your benefit to age 65. The second one is what your benefit is after age 65. And then that third column we'll talk about is if you chose a spousal benefit payment option, what your spouse's benefit would be. So that's why if you're past age 65, you don't have that temporary column because you've already missed that opportunity. Does that make sense? The program multiplier that St. Charles County has. Groovy. So talking about your final average salary, this just explains to you how it looks. So if you have multiple employers, if they have a 5-year final average salary on their individual pages, on that front page of demographic information, if they have a 5-year, they'll have 5 salary ranges. If they have a 3-year final average salary, they'll have 3 salary ranges. Does that make sense? Okay. Your final average salary will include your gross wages, everything gross, and sick and vacation time that you've used because you were paid for that as part of your salary. Overtime is also part of your wages. Recurring bonuses. This means you had to have received this same exact type of bonus more than once. So if you get a Christmas bonus, yay! If you get it more than once, it counts as part of your wages for that year, part of your final average salary calculation. Recurring vacation or sick buyback. So if you accrue so much vacation, you hit your maximum level that the county lets you have, and maybe they pay you for anything in excess of that. If they do that more than once, and it has to be that same type of leave, then that's included in your salary as well. And allowances for like cell phones, uniforms, anything along that. If you get paid for those regularly, those types of stipends, those are also included in your salary calculation. So, St. Charles County has a 3-year or 36-month final average salary, but that doesn't necessarily mean it's your last 3 years of employment. We go back 10 total years, so it's rolling. So if you decide that today is your last day of employment, we go back 120 months from today and find your highest 36-month consecutive pay ranges, and that's what we use to determine your final average salary, okay? I do want to point out sometimes, for the most part, it is your last 3 years because you tend to get those annual pay raises, but What if you decide to cut back your hours those last few years before you ease into retirement? Your last few years may not be your highest if you're paid an hourly wage. I give the example, I'm at this point where I need to spend more time with my own parents helping to take care of them. If I were going to ease back and I were an hourly wage worker, my last year of employment, I may not work as much because I'm helping to take care of my parents. So in that case, my last year of employment may not be the highest. Sometimes people work overtime, and I hate to bring up the COVID because we're all sick of hearing it, but what if you had to cover when there was an employee shortage and you had to work a ton of extra hours to make sure that the job got done? Maybe those years were part of your highest 3 years because you put in a lot of overtime in that time. So that's how we want to go back 10 total years to give you the best financial outlook for your monthly payment as we can. Does that explain all this fun stuff for you? So that's it, second part of the calculation. We've covered the benefit multiplier that the county has elected. We've covered your final average salary. The next part is your service credit. So again, that is on your benefit estimate that was projected forward based on the benefit estimate date that you gave me. The longer that you work, the more it's going to increase that benefit calculation for you. So again, working for more than one employer, you're going to have the employer name, the benefit program, the type of department that you work for. Now, there are several individuals that have worked for more than one long-term employer. So you have different calculations because each employer can make different choices. They can choose between a 3-year or 5-year final average salary. They have all those options for the benefit multiplier program that they want. So what we do is we have separate calculations, we add them together, and that's why you have that combined page at the very front. That just shows you your combined payment from all of your loader service. So that's what a calculation would look like. Different multiplier, different final average salary, different years of service. We do each calculation individually, add them up, and you get one combined payment every month. Questions on that? Groovy. Employee contributions, you don't have to make them, so I didn't have to cover it. In other words, St. Charles County is paying for this benefit for you. It didn't cost you anything, and so this benefit is your reward for all of your years of service to the county. Do you want me to keep going to the next part, or do you need to stand up, take a break, move around?
Keep going.
I will power through. I can do that. The application process. We have tried to simplify this as much as we possibly can. Now, the time to apply is no later than 30 days before you want your first payment. If you want your first benefit payment December 1st, that ship has sailed. You will now have to wait for your first payment for January 1st of 25. Okay, we need at least 30 days. You can apply as early as 90 days before you want that first payment, but we need at least 30. I will tell you the quickest way to apply is online through your My Loggers portal. Yes.
I have tried to get on My Loggers portal and I can't.
If you want, I will try to help you with that when we get out of here. And as you mentioned, it is a bit of a headache, but we are trying to make it more cyber secure. I don't know about you, but I received 3 letters in 1 year from the various accounts that I have telling me they've been hacked. And we are trying to avoid that with you. I am a retired school teacher. PSRS got hacked. Had to change a lot of my information. And we just don't want our members to have to go through that. Once you get into that portal, once you get it set up, I recommend doing that because it is so helpful, especially once you've retired, because you can change so much information through the portal, whereas you don't have to go to our website, pull up a form, fill it out, and mail it. Mail's not any better. And when you do taxes, it's going to be important that you can get into the portal. How to do that? So this is our website. If you don't have it, it's printed all over that booklet. Our website's on there. This is our homepage. So right here underneath this picture, you would click on member/retiree login My Loggers. When you click on that, it opens up a new browser tab. if you haven't been on it since July 21st, we've deleted all of your user account information. So you're gonna have to enroll now and use it no matter what. In that new tab, you click enroll now. If you've accessed it previously through a bookmark, you set a bookmark up and you just hit your bookmark and go to it, and unless you've set up a new enrollment in a new cybersecure account, don't use the bookmark because it won't give you the next thing. It'll tell you that you need to do that. I just want to, you do have the option of doing the paper form before he advances. There's this tab right here. It says members. And it's got a drop down arrow. Hit that drop down arrow and it has forms. You can always print that form off, fill it out by pen, and mail it to us. Scan it and email it to us. You can fill it out online if you know how to fill out a PDF online, and then email it back to us. Please remember that when you email information, you have to send it encrypted. We want to make you cyber secure, okay? But when you click on this enroll now button, and then you're going to get this form. You're going to be able to fill this out. Once you set it up, it's quicker to go through the portal because you get a response back far more quickly. And then we're also going to need a copy of a proof of age document. So it doesn't have to be an official notarized copy of anything. You can scan it and send it to us through encrypted email. You can upload it through your MyLoggers portal. It can be anything that basically verifies your age. A birth certificate, passport, military discharge, any of those. Again, just scan it, copy it, and get it to us. If you are choosing a spousal benefit payment option, then we will need your spouse's birth certificate and a copy of your marriage license as well. So you do have to provide both. Once you send us your application, you get your paperwork. Yeah, it's okay. This is good stuff. The biggest one is the election of payment option. So this is the form that tells us how you want to be paid your benefit. So definitely fill that out. Unfortunately, you're going to have to pay taxes on your benefit. And we'll talk about that toward the end. But you're going to get those tax withholding forms as well. The best part is that direct deposit form. Where is the money? I'm going to preface this by saying this is great. It's also right now a bit cumbersome. There's paperwork, that direct deposit form, where you have to go to your bank and your bank has to sign off on the direct deposit. We're trying to get past that and we're trying to upload more cyber secure methods so that you can set up that direct deposit without having to get the forms sent to your bank. It is a work in progress, so please be patient with us. It's coming. The beneficiary designation form, that's if you choose one of the options, like option C. All right, this part. This is the part that I do spend quite a bit of time on because, as I mentioned earlier, once you decide how you want to receive those payments, it cannot be changed no matter what life event might occur. So you really need to have discussions with the people important to you in your life, people who feel that they may be affected by your benefit payment. And you need to talk to your tax advisors, you need to talk to your financial planners, all that fun stuff. We have 4 options, and I'm going to go into detail about each one. We have the life option. Options A and B, if we kind of lump together because those are spousal benefit payment options. And then we have option C. You can take a partial lump sum payment with any of those 4 benefit payment options. But again, once you pick this option, first benefit payment, you can change it. Yes.
I was told that you can change the 10-year option. If your wife does,
You can change your beneficiary, but you can't change that you're getting that option C.
right, but that you can
You can change the beneficiary.
change it, and that's very important. The others, you can't add your new wife to.
Correct. Correct. And I'm going to talk about that too as we go through here. So on that second page of your benefit estimate, you're going to have 2 boxes. We're going to focus on the top box for now, okay? In that top box, you're going to have payment options, like A, B, and C. And then this is the payment amounts that you can see over there. So this is the one without the lump sum payment. That's what I'm going to talk about first. The life payment pays 100% of that benefit, based on that calculation I showed you earlier, it pays the most to you. 100% of that payment. So again, we're gonna use that example from previously, the L7 multiplier, $4,000, final average salary, 25 years of credit. That same example, it pays you $1,500 a month. That's the full 100% of your benefit. Now, if you had employee contributions, then you could have a beneficiary. And they would only receive any remaining employee contributions you had not received prior to passing away. However, if you have lived a long life in retirement, awesome, yay, way to go, and you've received back all those employee contributions through your benefit payments, then when you pass away, there's nothing else payable. Payments end upon your passing, okay? You could, if you had employee contributions, change your beneficiary throughout your retirement, and it can be anyone. It doesn't have to be a spouse. So an example of that would be if, let's say, you got that $1,500 a month, you pass away after only 18 months of payments. That means that there is a balance of $3,000 left of those employee contributions that you had made. Those go to the beneficiary. Once those are paid to the beneficiary, that is it. There's nothing else payable. I bring this up because some of you have had multiple employers. Some employers require their employees to help fund this retirement benefit, so they contribute 2, 4, 6% of their pay every pay period to help fund their benefit. Those are all guaranteed plus interest to come back to you through your benefit payments. A and B, they work exactly the same way. The only thing different is the percentages. Since there's different percentages, you're going to see different amounts in each of those sections right there. With this payment option, you, the member, have a lifetime monthly benefit, but it will also pay your spouse when you pass away. So because we're paying two people, 2 lifetimes of your benefit, we reduce the member's benefit, and then your spouse will receive a portion of your reduced benefit. So with option, your benefit is reduced to 85%. Or in other words, with that example, it would be $1,275 instead of that $1,500. When you pass away, then your spouse receives 75% of your $1,275, or your spouse would receive $956.25. Okay? That works under the premise that you're the same age. Option B works exactly the same. The only difference is the percentages. So with option B, you as the member receive 90% of that full lifetime benefit. When you pass away, your spouse receives half of that, or 50% of your monthly payment. Now, when both of you have passed away, both you and your spouse, there's nothing payable unless, of course, there are employee contributions that remain. Your beneficiary, we define a spouse as someone that you've been married to for at least 2 years prior to retiring, or it could also be someone who is at least 40 years of age, who's been more than half financially dependent on you, and you would need a legal affidavit to prove this. Now, people have asked me, who is this? Well, not everybody believes like I tell my husband he's happily married as he is. Sometimes people are in a committed relationship, but they're not married legally. This would qualify that person, your significant other, your life partner. In some cases, this could also be an adult child with developmental delays who has been more than financially dependent upon you, and you want to take care of that child in case you pass away first. There's numerous scenarios that this would fit, okay? So this helps out quite a bit. Now, the beneficiary will receive a portion based on whether you chose option A or option B. Once you set that first payment, you get it in place, you can't change the beneficiary. So let me explain. If you retire, you start receiving that monthly benefit, but then you decide you and your spouse don't like each other so much anymore. You're not as happy as I tell my husband he is. And you decide to divorce. That does not change your benefit payment. So if you pass away before your ex-spouse will receive your benefit. If you remarry after this life event, your new spouse cannot be added to this benefit. It's still going to be your ex-spouse that receives it. So not only do you have to make sure that this is the right payment option for you, you need to make sure this is the right spouse for you. Just saying. If, oh, let me go back. If by chance your spouse should pass away first, predecease you pop up to that 100% lifetime benefit payment. However, if you remarry, you can't go back and then add your new spouse to option A or B. You just stay popped up at that 100% level, and your current spouse will have to have maybe a life insurance policy on you. However you want to work that out. But that's what I said, life events don't impact your benefit payment unless it is you who is passing away, or if your spouse passes away and you need to pop up. Okay, so you really need to be sure this is what you want to do. There is an adjustment if there's a yes.
If it's paid into a legal entity, none of that comes into play, right?
Well, that's a different payment option. That's option C.
Okay.
I'll
Sorry,
talk about that in a second.
jumped ahead there.
So you said the benefit that was reduced under these choices, your wife does, you go back to a higher benefit?
You have lifetime payments, which is option, and it stays there until you pass away.
Yeah, I did not see that in any of the documents.
It's in the booklet, it's in all of our materials. Yeah, if your spouse predeceases you and you choose an A or B, you pop up to 100%. And again, if you remarry later on, you still stay at that 100%. You can't switch back and then add your new spouse.
You have to know about the age of the spouse.
Yes.
The same age, what's the difference? My wife's 5 years older than I'm.
On your benefit estimate and that notes section, it tells you the adjustment for age that is made. Because the reason for this is, let's say you were significantly older than your spouse that were younger. They need to know how much longer you're going to have to pay somebody. They want to know how long you're going to have to. They make estimates based on mortality rates. So
It's adjusted.
it's been adjusted for age, and it tells you the percentage of it in the notes section. That's that very last box on the second page. It tells you all those adjustments.
Thank you.
Sure. Yes.
And you said that you have to be married for 2 years,
Prior to
your date, prior.
in order to be eligible for the option A.
Okay.
Yes. So again, that adjustment for age is on your benefit estimate as well. Now option C. This one is called the 10-year feature. This allows you to have the beneficiary of choice, and it can be anyone, any entity, person, trust, charity, anything you want. But you have the beneficiary for 120 months or 10 years. Because you get that beneficiary, your benefit is reduced 95%, and your beneficiary just receives your remaining payment. So if you pass away any time in that 10-year period, they get all your remaining payments up to that 10-year mark. Once you reach that 10-year mark, that's it. There's no more payments that are made. So there's an example of that right there. And that graph is in your booklet as well. Oh, I forgot to tell you, these little numbers at the top. Wait, let me see if they let me use that. I have the laser pointer. Those numbers correspond to the booklet pages. So if you're following along in the booklet, that's where we're at on those pages right there. Now, option C is one. Sometimes we have members who are not married. They've never had children, but they have close family members or close friends, and they want to remember that person. Or maybe they're very close to their faith community and they want to leave something behind. This would be a option, a benefit payment option. And it just guarantees that they would have a beneficiary whomever they want. This beneficiary can be changed at any point in time in retirement. You can have multiple primaries or multiple contingent beneficiaries as well. But again, if you get to live a long, wonderful life and retirement past that 10-year mark, awesome, you still keep getting your monthly benefit. It's still gonna be the same benefit, that 95% rate, but you no longer have a beneficiary after that 10-year mark. So again, this is a way, sometimes people want to leave something for maybe adult children, or again, any entity they want. Are there any questions on this one? Now, you'll notice none of these options allow you to leave anything to your kids, other than option C, if you want to choose that. However, some people do want to leave something for their kids. I told mine they're on their own. I've supported them enough. But if you wanted to, a plus payment, and that's the part you could leave behind for your kids if you wanted to. This is the second box. So the top box was without the plus. This is the bottom box, and here will tell you how much your plus payment is. Now let me preface this. Whenever in your benefit estimates, it can project your service credit and your birth date. It cannot project your salary. So if your benefit estimate date that you gave me was at least 2 years from now, it's only going to be basing this on your current salary. All of these benefit payment numbers that are on there are going to hopefully increase. Hopefully you'll get a pay increase in the next year or two. You're going to end up working in a year or two. And so those numbers could be slightly higher, which means that plus amount would be slightly higher too, because it's all based on just current salary data that we have. Does that make sense? So these numbers could change based on how far away your retirement date might be. Now, this plus payment, that's the amount. And the reason we have this second box with different numbers is because if you decide to take the plus, it reduces your monthly payment by 16%. This plus is 24 months for 2 years worth of your benefit payments taken all at one time in a lump sum. You indicate that in your benefit payment election form that we would give you that you want the plus. And then once you get the ball rolling into retirement and you get that benefit, they're going to ask you, what do you want to do with your plus payment? Do you want to take it directly or do you want to roll it over? And I'll talk about those in just a second. So you're going to get that plus. It's not when you get your first payment check. It'll be 90 to 150 days after you get your first payment check. Okay? Keep in mind, it reduces your benefit by 16%. If something happens, you pass away prior to receiving that plus payment, then your beneficiary won't receive it in your stead. It's still going to benefit. Now, if you want to take it directly, you want it for you. Maybe you want to pay off your mortgage so that you don't have a mortgage payment in retirement. Maybe you've accrued some medical bills, you want to pay those off. Maybe you want to buy a Harley and ride off into the sunset. Maybe you need more wheels to maintain your balance, you get an RV, whatever. If you take it personally, directly as a payment to you, we automatically have to send 20% to the IRS. Taxes. However, if you wanted to roll it over into an equitable retirement account, and it does have those eligible retirement accounts in the booklet. You can look at those in that booklet. You can roll it over there. We don't have to take that 20% off. You only pay taxes on it on the amount that you withdraw when you withdraw it from that account. Does that make sense? Now, if you take that plus payment and you want to withdraw it from that equitable account, keep in mind you have to meet the requirements and the eligibility to withdraw it from that account. There could be, if you take it too soon, you have those penalties. That's something that you have to keep in mind. Okay? Now, something else I want to talk to you. Here's the thing. Sometimes people want to take that plus because, as the gentleman told me just yesterday, that's guaranteed money right there. What if he gets that plus the day after he retires? It's not going to be his lifetime benefit. If he took that plus, he's going to have that money, and he wants money in hand. I was like, oh, that's a cool plus. I like how you're thinking. So that's why when he retires, he's taking that plus payment. Plus, he has adult children. He wants to leave them some sort of inheritance, and they can be beneficiaries of a 401, a 457, or an IRA. Whereas without employee contributions, you don't, the only one who could benefit from your benefit is a spouse or a significant other 40 years or older who's been more than half financially dependent on you. So those are various reasons why people might want to take that lump sum and then roll it over. Another reason is they don't want the whole amount, but they need some of it. Well, you have to take the whole amount. So the best thing to do in that case then is to roll it over and then take out the amount you need. Someone told me, well, I just need enough to put a new roof on my house. Well, you have to take the whole thing. You can't take part of it. Roll it over, take out what you need to put that new roof on, leave the rest in, and maybe it will continue to grow your assets in that account in that case. There's numerous reasons why people want to take the plus, and we will never, ever advise you what you should do. This is a conversation you have to have with your family, with your accountant, with your financial planners, because we don't know your financial situation. So how on earth do we advise you which option to take? You have a question?
So it's 24 months of the payment is the plus option,
Yes,
and you can't select higher or lower, it's 24 months, that's it?
that's it.
Okay.
Yes. I would recommend, and people have asked me because I'm open about the fact that I'm retired. I'm collecting my teacher pension, and I had to make many of these choices. So some of the discussions that my husband and I had, well, first of all, we did talk to an accountant. I will tell you, it's not because I was making $1 million as a small rural high school teacher. It's because I had kids. Those kids went to college, and I could not for the life of me figure out how to pay taxes when we were dealing with their school fees, their scholarships, their financial aid, and I was like, please, I need help. So that, and I will tell you, I was a small rural school teacher. I had more than one job, which meant I had a lot of W-2s. It was just overwhelming. So I had an accountant, and I love living in a small rural area. My accountant, I taught all her kids. We had a good relationship. Luckily, she liked me. So we talked to her. We said, what should we do here? What are the best case scenarios? And we also have a financial planner, not because of anything I'm earning, but my husband has a 401k. We have IRAs because of his retirement accounts. And so we were like trying to figure out what's best case scenario? What do we need to do here? And honestly, I looked at, yes, I wanted to retire from teaching, but I do have another job. I like being around people. I don't like driving in the traffic to get to the people. That was a little stressful this morning because I'm from a small rural community. My biggest traffic is a tractor. It's really not that big a deal. Here it's a little overwhelming. But I wanted to make sure that my family would be taken care of. And I know it's a career, so I'm not that worried about health insurance until I want to retire. That's something else to consider too when you're timing your retirement. Is your health insurance taken care of? Do you have to depend on a spouse for health insurance? Are you waiting for Medicare? What do you know, all of that plays into it, and we don't know your individual situations. We don't know, do you have life insurance? I used to work for a life insurance company. I am working in life. But my husband also knows he's stuck with the kids if I'm dead. He wants to keep me around. But our children are like, still. You know what I'm saying? So there's just numerous considerations, there's numerous factors, and that's why we don't tell you what to do. When people ask us, well, what do your members do? Well, about half of them take a plus. It's a 50-50. But we don't know the reasons, we don't ask. It's completely up to them. All right, so that covers your payment options. And like I said, it is a ton of information to think about in the process. So you want to take your time and think about it because you can't change your mind once you receive your payment. All right, do you want a break or the rest of it goes down through? It goes fairly quickly. Cool. Living adjustments. This is what my mom calls a raise in retirement. So every year, our number will look at the consumer price index, and we want to make sure that our retirees are having full financial purchasing power, and retirement. This is why we exist. It is for our members. It is for our retirees. We want to make sure that they're taken care of. So every year they look at the CPI and they will make a recommendation for a cost of living adjustment. And here's the thing, we cap it at 4%. If CPI says, nope, we need to give people 8%, we cap it at 4, but we're gonna roll over the excess. Now, you have to be retired for 1 full year, including at October 1st, to get the first COLA. But I just told you, it's cumulative. So you don't freak out if you retire in November or December. You won't get that first COLA on that first October you're retired, but you will the next one. And because it's cumulative, we're going to get you caught up to where you need to be. So we have members at different COLA levels based on when they retire. And our members know these COLAs, and we're being financially smart by capping it because we can't get too carried away. We still have to protect the assets of all our members.
So do you use the same code that like Social Security uses, except it can be as high as 4%?
I believe so. We use the CPI to determine it, yes. And I believe that's what Social Security does as well. Yeah. But again, it's cumulative. So even if you don't get more than 4%, don't worry, the next year we're going to get you caught up. Even if that means we have to give you a 4% increase every year until we get you to where you need to be. And we have had members that have been getting 4% multiple years in a row so that we can get them caught up. Yes.
I was wondering, would you happen to know, inflation just went to 9%. You can only get 4%. You know, what payments did you pay out to get caught up? Because we're still close to 3% probably this year. So are you still trying to catch up?
Some members are still catching up. So if you were you retired 1 year and you got an October 1st of your COLA was 2.63, 2 point something around there. However, if you retired a couple of years ago, you're at a 4%. It's based on when you retired. So we're getting people caught up because people's current benefits reflect those wage increases that we're supposed to, set.
Right, but there's no catch up with what you missed, right?
Right, because you weren't retired then.
No, I'm saying inflation was 9%. You could only give 4%. Now I gotta go a year minus 5% of the increase. And then the following year it dropped down to maybe 3 or
But the
4.
following year, we're still getting you caught up from the previous years. So you get that 4%, to get you caught up to where you need to be. So we should have given you 9 because of CPI, but we capped it at 4. Okay, you get 4 this year. The next year, you're gonna get another 4 because we gotta get you caught up to that 9. Well, there's still another 1%. So the next year, you're for sure gonna get that 1, and then whatever else the CPI says we have to be giving at that year. So we're gonna keep rolling over and hitting the max until we get you to where you need to be.
Right, and is that shown, like where you are, like,
So when our members get on that midline
5% short, and then I'm 4% short, and then I'm 3%?
we put it on your My Loggers account. You're gonna see how much of a COLA that you get based on, okay, here's what I got paid in September, here's my October 1st payment, I can see the dollar difference amount. And if your My Loggers will tell you what your COLA is, we send emails out, we send mailings out to our members to say this is what your COLA will be. So we inform our members through email, through their My Loggers portal, through correspondence, and so that's how you find out what your COLA is for the year. So that's another great option for having that My Loggers account too, is in retirement, let's say you do buy the RC and you decide to move constantly, and you change your address, your mailing address, you can change it in your My Loggers portal. It's 100 times easier than filling out the forms. And we have to talk next about taxes.
When is that COLA determined and when is it implemented?
COLA is determined, our board votes on it in September, so it's recommended around August, our board votes on it in September, it goes into effect every October 1st. So when you retire, you have to tell us if you want taxes withheld from your benefit every month. If you don't, we don't withhold any taxes, but it is subject to federal taxation. So you have to pay federal taxes on your benefit. It's not an income tax, but it's taxable, okay? It's considered taxable income. You get 1099s every January. On your My Loggers account, you get them quicker than if you get them paper mail. So that's another great reason to maintain your My Loggers portal, is you can get on there and you can print off your 1099s as much as you want to from there. If you take the plus payment, you get a separate 1099 for that as well. And you guys didn't have to do employee contributions, so I'm not gonna worry about that part right there. We won't tell you how much to withhold. You're gonna have to talk to your tax professionals or know that yourself. Do your own research for that. So however much you want withheld, you have to determine that. We're not gonna tell you how much to withhold. There is a Missouri public pension exemption. So maybe up to 100% of your logger's benefit could be exempt. It's limited to a maximum Social Security benefit of a spouse. It's around $37,000. So if you make more in your logger's benefit than that, you're taxed on the overage. Does that make sense? So some people still choose to have Missouri taxes withheld from their logger's benefit just to cover other taxable income that they might be receiving. So you can withhold state and federal tax.
Can you say you don't have to state tax?
As far as so you're exempt. Like if we add up your benefit for the year,
And this would just be for me or me and my spouse?
just for you,
Okay.
your benefit, your benefit, if it exceeds around $37,000 for a year, you will pay state taxes only on that overage.
And if it's less than that, then you pay your state. Okay. Thank you.
You have that public pension exemption in the state of Missouri, unless it changes. But you currently have that.
And then, can I pay, will you guys only pay Missouri? Will you only deduct taxes for Missouri, or will you do it for Texas?
If you move to Texas, you gotta give us the Texas withholding form. You're subject to whatever state you live in, their tax requirements. So if you have to be changing your exemptions for a different state, you have to send us those forms.
You will do that?
Yes. And that's another reason why you really need to keep up that My Loggers portal as well. So if you do move, we can keep track of you to make sure you're still getting your payments first and foremost, and to make sure you're getting those accurate 1099s. Yeah, we have members who actually live in other countries. So do keep in mind, you are subject to the taxation rules of whatever state you live in. Federal, you're gonna have to pay federal, okay? But as far as states go, you have the Missouri pension exemption. I don't know what other states do.
Are the payments for
Yeah, but you have to find that. They can be direct. They can absolutely be direct deposit. You can also get a paper check in the mail. I know sometimes people have struggled to receive their mail, and we've had to reissue checks because their mail never arrived. That's why a lot of people don't want to go to electronic banking, and I completely understand, but it is a bit of a painful process currently. It is in the works to change that, where we don't have to have that document sent to the bank. I'm sorry?
How soon do you think that'll happen where you won't have to go to your bank and have them sign whatever?
We're hoping to get that changed in the next 6 to 9 months. It's a process. If you retire from a public safety position, you could be eligible for up to $3,000 of your health and or long-term care premiums for a federal income tax exemption. So That is definitely something, if you are a public safety employee, you might wanna check into.
And do you know who that is? I'm
You would have to know who that is.
It's like this guy, he stands in the middle of the road striking.
Public safety means you have to have a certain certification that qualifies you to do it, like a jailer, a telecommunicator, or a first responder. And it requires you to have a specific certification in order to do your job. I'm not doubting that your job, your life, I've seen the traffic around here, your life is definitely in jeopardy out there. But it doesn't qualify you as a public safety employee. It refers to the type of certification you have to do your job. You're considered a general employee. And if you were a public safety employee, you would know it. Like, because you have to have that certification. And it would also say it on your benefit estimate. Your department would say public safety rather than general or police. Working in retirement. I love this part. This is my favorite part. The reason it's my favorite is because we are living long, wonderful, fruitful lives. I believe I am. I'm retired, and I get to collect a retirement payment, but I've started a second career. And that's, I believe, the beauty of retirement is that you have options. And loggers really helps you to think about all your different options. Now, if you want to, you can just live the grand life, travel, spend time with family, hang out with friends, go fishing, hunting, whatever it is you want to do and never have to work again. Cool. I wanted to keep working. I just didn't like sitting around. I like being around. So you could have those same options if you want them. If you want, you can still get a retirement benefit every single month, get that check every single month, but work full-time somewhere else. And you can do it online as an employer. So like, for example, I'm not in education. I'm in education. I'm not in public school education. So I get my retirement. I'm working somewhere else for loggers. I get a paycheck from loggers. All is well. If you wanted to, you can do the same. Work for a non-loggers employer, or you can work part-time for another loggers covered employer, including this one. However, there are certain conditions if you want to do that. When we talk about part-time or full-time employment, it means what hours annually that loggers covered employer has elected. For example, in St. Charles County, to be considered full-time eligible for this loggers benefit, you have to work 1,500 hours annually. That comes to around 29 hours a week. Some employers have elected 1,250 and some have even elected 1,000 hours annually. If you stay below that hourly election, you're considered part-time. You can work for any loggers covered employer part-time and still receive your benefit that you've accrued so far.
Are you confirming that St. Charles County is 1,500 hours?
Yes.
Okay.
I looked it up. They are 1,500 hours. And how you work that 1,500 hours is sort of up to you and your employer. Maybe I have some people that work like they're workers, so they work in the winter months clearing the roads and then they take the summer off. They still stay under that annual hours of coverage. Some people will work 2 or 3 days a week. My aunt is actually a loggers retiree, and she works seasonally. She works for health department, so she works in a immunization workshop. So she'll work 2 weeks and then have a month or 2 off, and then come back and do another immunization workshop. And that's how she works it. Sometime on, sometime off. And it's completely up to your employer how you do those hours and how you stay below annual hours of coverage. You want to do that so you don't risk your current benefit. If you want to, you can go back full-time with a different loggers covered employer. You have to take a 1 month break in employment. I like to call it a vacation, a 1 month break. And once you do that, you can work somewhere else for a different loggers covered employer. And after a year, you're vested instead of 5 years. And you begin to accrue a new loggers benefit with your new employer. I worked for a job yesterday. This was his 3rd retirement. He'd retired from 2 other loggers employers, was receiving benefits, and was working in Columbia for a different loggers covered employer, and is going to retire from them next year. When that happens, when you retire for good, we add your current benefit that you're accruing with your new employer. We add it to the one you're already receiving, and then you get one new updated bigger payment. So you can continue to work if you want to. You're vested after 1 year too, instead of after 5 years. So that if St. Charles County says, we just can't do it, we need you to come back, and they beg you to come back, if you come back full time, we have to suspend your benefit. You'd begin to accrue a new benefit with this same employer. You have to work for a year to be vested again. Then when you retire, we add the two benefits together. And we resume your old one, add your new one to it. So that is something to think about. Do you really want to retire from this one? Are they going to let you go? And do you really want to do that? Because, I mean, you're going to continue to accrue new benefit if you come back to St. Charles County. The thing of it is, though, is to get this new benefit, you have to be there for a year. It's like you're committing for at least 1 more year. So think about that in terms of your options. If you come back to the same exact employer you're currently receiving a benefit from. All right. That's the presentation. I think I kept it in my time. I did. I kept it to my time limit. So do you have any questions for me about working, COLAs, taxes, or any of the other stuff now that you've had time to think about it? Yes, sir.
If you retire for a year and then come back to the county, can you still keep your retirement? Or
If it's the county, then we still have to suspend your benefit.
even if it's a year or 2 years or 5 years?
You can't draw a benefit from the same employer that you're receiving the benefit from. So even if it's a year,
Right.
6 months.
The only way to do that is to go part-time.
Correct. You can do it part-time, but not full-time.
Not full time.
Yeah, you can absolutely do it part-time. Under 1,500 hours. Correct. And then again, how you fill that 1,500 hours is totally between you and your employer. We don't say you have to work so many days a week, whatever it is. It's like I think in education it was you couldn't work more than so many hours a day in a school, public school, otherwise you risk your retirement benefit. You have to suspend it. Until the teacher shortage, then they changed that. Great questions. If you want a benefit estimate, but you didn't receive one, didn't get registered in time for it,
Now,
do this list together if you'd fill it out and just tell me how, one, the information that I need to run that estimate, and two, how you want to receive it. So we can do that for you. And if you get a full version of this, a business card, I can do that for you too. And I can tell you who your,
I'll probably just go on.
okay, you can do it on, you can create your own through the portal if you want to. And you all have a benefits specialist who works just for the city, who will help run an estimate for you, specific to you, and ask your specific benefit question, answer your specific benefit questions. Yeah.
Our lawyer didn't make it, didn't want it for her, how did she get that from you?
I gave it to this, I gave the extra ones to this gentleman, so they would get them to those employees that were unable to make it. So, I don't know if it's mail or
No, that's
something.
just so she asked.
Yeah, I'm leaving them here for sure, but I have to leave them, how do I say this? They contain personal and private information, so I can't just, I'm sure you're a very trustworthy person. You look very trustworthy.
You don't know him very well. We'll change your opinion.
It needs to be figured out to get on.
Thanks, Dennis.
No problem, Diane, anytime. You do the same for me, I know.
I can put it as a new person. I create my passwords and all that stuff.
So the new look, so I totally forgot.
I was going in.
And you, so you can have your insurance, and then you get the general pay.
what MoDOT people,
The one thing that they have, if you use that app, really nice. It doesn't like it, it won't let you use email address for your username and password. And when it sees that,
I didn't use none of those.
okay.
So
Well, do you, are doing it?
Is that?
I need to.
2%.
I was hoping, yeah. And I mean, I've been trying to here and just.
I can come with you.
This is blue sweater.
Can you just stairs?
Yeah.
Cause these two
Unless anybody has other questions.
I've got a personal question. Sounds, I have an unusual situation I want to walk some middle. So I was a commissioned law enforcement for 13 years. But now, if you get your license for 5 or 6 years.
I'd be better if I stayed for that.
It's all
I get any what?
comes to
Was it a long?
becomes part of
the deal.
yeah.
In that department, you can have that.
I don't know, so the job's gone. The city's gotten rid of, so is there, so I don't get the, I can get out there.
Yeah, big raises like he did everybody.
So that's what you're currently, back to you, were.
And they took over.
things in
Or
the
retired,
airport.
in that department. Then you can retire.
Yeah, everybody
I took the day off yesterday.
while they could still
Since
get
you're no longer in that department, you're now.
so they get massive.
Supervisor for like 6 years.
And to see Ryan.
Is that the same for the, I don't know, that's very in there. Law enforcement.
They already did say that they're looking for side shit. St. Peter's. Sign
How
him.
much service you have to qualify for that.
Okay.
My retirement is go way down though.
That's what the airport.
That's what I said, 2047.
You want 2047?
You want to put standard.
2047. That's 1 month.
That's a whole like.
Okay, you want to. Can I have your email?
Oh, I was waiting
I mean, I could probably look it up in the system.
But maybe you.
Be sure
I
it's
need
the
to go
one
while
you
they still alive.
Dave's gotta work tomorrow, he's got 2 young. I was a bummer, I was hoping to gain the system.
Yes, because that's one
Wife's
that.
gonna get a job.
There you go. I was wondering maybe if I just keep asking enough, maybe someone would be able to change.
That much a month?
Never hurts to ask. Rules change all the time.
13 years, that might be enough.
Thank you very much. You're welcome.
Yes, we did change up the sports stop signs the other day. I don't wanna be in town for 6 minutes, not even 36, that's just.
Isn't that that proper height?
That job.
The guy who started yelling.
I wouldn't wanna be in town.
I've got up to
Well,
They've been done.
I heard it from Max today. I didn't recognize it. I said, I did not.
Trying to figure out how to get
I
it.
didn't want to.
And I'll take it back to you. I'll do it this afternoon. I'll do these benefit estimates this afternoon when I get back to the office today, so.
there's an asterisk saying at the,
I will send it to you. Whichever you prefer.
the employer lacks money service.
Yeah. They may
What's
not
the
adopt
procedure
it.
for that?
They have to adopt the public safety
Why'd you put that
actuarial
yellow
report.
flasher down?
So they basically have to see and enroll.
Yellow
It
flasher
is
down.
a very complicated costing process.
I get it.
I have a few park rangers that are now non-commissioned.
I didn't see that. See
They're out
see
in the
what
weather,
happens?
they're out, you know.
You put
I was
But again,
wondering,
it
what's the
has,
procedure?
has to be certain certifications.
Playing
I
roads.
understand that.
Your job.
Yeah.
So that is
That road is going to be changed.
Sure. Yeah, it's costly to the city. And, yeah, and then they would have to.
How are we doing?
Change
They're
every.
straightening it up.
Okay.
I was gonna ask David, what do you think? It's tricky, lots. We'll take it.
But you're not in the 60s.
That's waiting until he's yeah, every minute, no matter what.
Maybe, I'll see what happens. But
Anyway, I think anyway,
We're not gonna do it in 30 minutes, because I can go to 30, but it's
That's why I have to get going.
literally do, you know.
Are you going upstairs? going upstairs?
Yeah, this is benefit specialist.
Oh, not.
Put down to days, I'm gonna start doing days. Then I'm gonna do days.
Well, you can go.
No, I didn't wanna do that yet, I was.
Section of road gap.
On the roundy.
No, all about highway end, where it's closed right now.
Okay.
So it's not somebody,
They just redid the road.
it's somebody
There
done.
used to be a flasher light that told you this is coming from Wharf Road. It was a T sign, or side road sign. It had a flashing light on it.
Yeah, I.
Yes, and asked for Stephanie and she said, the way to see.
You're in charge of that.
Misunderstood, I think she said city.
Is it recurring? Have they
Don't you remember?
paid you for that?
Stephanie.
If it's a one-time buyout, that's not gonna be.
Contract. I wanted, those things, it cost me $2,000.
Right, we were looking for it the other day.
And,
It's called a one-time.
Ladies, what do you do?
where do you think, who do you think put it up?
Dennis,
I, who do you think?
they would have, their
I did. Who do you think?
their employees have.
Use it somewhere else.
Having no retirement, they have more than employer.
Oh, you just wanted to know.
So I don't, and I said, you trying to come take the checks? We do that every.
Sign check.
All right, going off.
I said,
I'm like, find you.
I mean, outside.
you know that contract. And then so it didn't call me, for a week, and so I called him again and said, what's the answer, where's this flasher?
Yeah, let me grab one. Yeah, I left my flash drive or something, I wanna make sure it's going.
Flasher's not there.
Hi, Rita.
This is what, yeah, they make great party things in your.
So many different jobs. I want to get done.
Shed, come pick it up. Find this shit. Throw it away. I said, this is bullshit.
So he don't?
We would look for what,
They don't come in the office.
Yeah, if, well, if you don't have it,
Yeah, we don't get you hooked up into our system. Why everybody slip a paper that wanted a benefit estimate for me today?
They reinvented it, they work from the,
well, then you need to have it.
every time I go on their job site, they're not there, they're correct. And their truck ain't there.
Correct.
So, 2 and 2
You have to do
means
that.
They're
they're,
When you plan on that. Oh,
Maybe I'll send it.
while I'm at this class. I can't take it any longer.
What up?
Thank you all, thank you so much.
Coming.
Oh, hi, okay.
Would an email to Nathan help, and copying Ted or John, at least to solve the problem next time?
The kid's a real nice kid.
Oh, wait a minute, maybe.
She said if it's a.
There's another one on Interstate, okay? He's clueless too.
Does he get 4 checks?
But that's what happens when the experienced people leave. You don't have somebody to mentor the new guys.
Because I didn't know that.
Only experienced guy we got is
So,
Howard.
I have to bring that enforce a payment and I'm putting it in.
He don't do nothing,
So that I
you
only
know?
taxed on
And who wants to keep it?
I've never liked them for the
So,
20 years that I've met.
You are welcome.
I gave him a piece of my, I'm trying to get that flasher.
Glad to hear
And
you're on the
then put
road.
it back down in the
Box
So they keep getting hit.
But that's the first.
I hate it.
That's gonna be hit.
Well, mine is like, I just wanna have some fun instead of working.
I do whatever I.
I can't buy any right now.
We need to just.
You know, just common sense. My God, a tall flasher, you know, and you didn't think of keeping it? I mean. Young people, they just, their brain.
How much longer you got? 2 months? 90
My dad told me when I was at 50, keep on working and you'll be dead before you ever retire. He said, I've seen it all my life. Our people retire and 2 years later they.
Seems to be the county
So,
mode.
yeah, getting more money, getting more money.
He is now.
We went straight from high school to code.
I know what you're saying.
That doesn't happen in today's world.
Yeah, you wanna sign in for
I'm
me?
like, and, you know, if they up the years.
It doesn't start till
You
11.
was 65 and you're baby, you're like 67.
Okay, I'll sign in, I'm gonna
Okay, sure. Is it nice out?
It's gonna come.
It's better than yours for the last few
You don't
days.
understand.
Both go out that way because they're new class.
He does have a point.
So they can.
Oh, no. I actually haven't. I do too. Hang on, right?
I was the one that said,
Oh, okay. Yes, yeah.
yeah, do the spend down, and is that only over 2 months? Is it over 3 months?
It's usually the last 4 pay periods.
You're talking about the PTO payout?
Yeah.
Yeah, it's usually the last 4 pay.
Getting a little bit of weird artwork in the front, so we're gonna set
You're
this
gonna
up just in case.
It tells you
And
it's.
then how do they do it? You don't take vacation. Cause I'm saving on my vacation.
Also,
Do they know?
just as a reminder, maybe we should let people know before the next.
Yeah, we were supposed to that microphone screen when we signed off. It was a
Have I done the calculations?
spearheading. I think it's never be that.
We couldn't hear that, but it might have to do with the microphone.
Been through this road?
Oh, it's something that's either on top, on it.
They don't.
I think we'll just put it,
They
yeah.
don't want the county to. They get mad about it. So I didn't wanna bring it up. But all my calculations,
She was a lawyer.
nice thing that the work does to get you.
Already?
She's already gone, but we can get it to her.
I get you.
Email that to her.
If you could,
Yeah.
I walked in.
6 months? If you're not happy talking to her, you call Paul.
For experience too, I have turned off the microphone up.
Call me old fashioned, but it's
Talking,
someone who
you
can
can hear me.
No, I'm just waiting.
Talking.
I forgot my ID.
They got a lot to do.
You should be able to hear me, you should be able to see the car.
It's a good deal.
Don't feel like a lot.
I got
It's
you
gonna
down
cost
on
you
his
a year
road.
to walk.
He's gotta go to a bunch of floors.
Basically,
While illegally drunk. He'll just reduce that. Yeah.
She said she's got a petty cash request in.
I had to do it as a check request, she was over $100.
said 8 weeks.
Okay.
It's over
Excuse me, everyone.
checks.
I have to check the audio ceiling microphones real quickly for our recording. Can I
Oh, that's
just
8
take
weeks.
2 seconds of silence? Don't mean to be rude or anything, just wanna make sure that I can do this
The
task.
reason why they calculate.
2, Corey, please let me know if you can hear this properly.
Deal with the benefits.
Check 1, 2, check 1, 2, check 1, 2. Corey, please message me if it sounds good. Check 1, 2, check 1, 2, check 1, 2. But you can hear this fine. Yep, there is a delay, that's understandable. Check 1, 2, it sounds better. So, interesting, okay. Check 1, 2. Check 1, 2. Check, 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 1, 2, talking, giving a benefits presentation. Check your email for important information about 2025 open enrollment, medical health insurance plan. Cigna Healthcare will be at your healthcare provider. SA plan, okay, interesting. Okay, thank you everyone, sorry about that.
That's okay.
let's get up out of our seat.
Yeah, for sure.
Or.
You don't have to get up.
Yeah, we can get up. Yes,
All
we
right,
need to
all
get
right,
up.
okay.
In fact, I should probably
Stretch a little bit.
walk a little bit. Yeah, we sat there for all day. You're stuck with
Good.
us. Where's a good place to go get lunch in between, if that's allowed?
Absolutely.
Corey, down the volume on.
Usually
Is
you
that
usually
close?
order from there, yeah, it's just.
Yeah, big A's.
Check one,
Okay.
check
There's
two, just
that place next to Picasso's, it's not half bad, like Fault Line, I think it's called.
check 1, 2, check
Not
1,
half
2.
bad.
Okay, it's
It's like,
it doesn't
my
look like
husband
it's.
says, here, taste this. I'm like, is it good? I'm
Well,
like,
I did
no,
get a
never
big
mind.
bowl of chicken and dumplings for like $5.
Oh, that's,
Where's
that
that
actually
at now?
sounds good.
It's like next to Picasso's, right next to it.
Where's Picasso's?
Is that next to Big Ace?
No, so what you wanna do is like walk right down the,
Like in between the courthouse and,
yeah,
okay. And then get down to the, and then
Then
go
you
left or right?
pull a right, and then
Okay.
you walk as soon as you see a sign with
Picasso's,
Picasso's on it.
yeah.
Yeah,
What's
the
the
name
name
of it again?
Fault Line?
yeah, Picasso's the
Yeah.
coffee shop, Fault Line.
Oh, okay. I haven't been there, but there's also like there's
Is
a
that
big
where
A's.
the,
The big A's is on your left. If you go to the right.
Where
That's where
the
he's
deli
talking.
used to be?
Okay.
Yeah.
Oh, we can
Do
decide.
you remember where the
between-
deli used to be?
Yeah, where Valenti's.
Yeah.
Yep.
That's where it is.
Okay. I haven't been to that one yet. So
They got like,
where it used to be.
got like, I think some like Italian, they got personal pizzas, hot dogs, burgers, sandwiches, a little bit of everything.
Was it red coat?
There was a bread cut down
Red
there.
coat
Oh,
there.
yeah, there was.
And there was also a,
So many years ago. I
Jeep.
forgot about that.
Yeah.
Chevy's, or what was the, there
Was
was
it
a.
Chevy's?
No,
What
what was
was,
it?
what was the, it was a restaurant.
Mm-hmm. I'm trying to think of the
And
name.
that same right there.
Yeah.
I wish Tulane was.
There's Mr. Thirsty's down there. They got some really good, their burgers are really good. They're decent priced.
Thirsty.
It was a chain in St. Louis, St. Louis chain.
Check 1, 2.
For Mexicans?
No, no,
For the
it
deli.
was where, right beside Bread Cup, when I first moved here.
There's also a Mexican place down there called El Tío Pancho. Yeah.
Yeah, I've
It's
been
down
there.
too. Yeah.
And there's another one too called Mark's and.
Oh, Margo.
Margo.
That's close.
They did?
Oh my
That's
God.
what I heard they closed.
It's next to Honky Tonk.
Right. Honky Tonks is really, well, but see, they don't have
They had
lunches
really
anymore.
good.
I know,
Yeah.
they were owned by the same
Yeah.
company.
Yeah.
Have
Yeah,
you
the,
been to?
Honky Tonks, but they don't have a lunch except on, I don't know.
The one I miss is Tony's Lunch Buffet.
Oh, yeah,
I hated it when he
Yeah.
did after COVID, he didn't open that
He
back
did
up,
with it.
yeah.
cause he don't.
There's Lewis and Clark down there too.
Oh, yeah.
But they take a little while to get, I mean,
Yeah.
they take a little while to
Pretty
get the food.
Not terribly
So you
expensive.
got all kinds of options.
Every July, I usually order.
And there's Savers, that's pretty good too.
It's pretty reasonable.
You
Like,
said they had chicken
everybody
and
else is like
Yes.
30s.
I'm gonna pull up, now I gotta use the restroom.
Yeah. I'm gonna walk then.
Yeah, and it's good. I mean, everybody's taking it.
For Fault Line.
Yeah.
Oh, pardon me?
Oops, it's extreme myself. Oh. That's in time. Thank you.
Essentially, that microphone, perfect, crystal clear, great, picks up everything. Corey was saying that he could hear the conversations about the deli and he knows where he's gonna get lunch.
Oh, gosh, sorry.
No, you're all good, you're all good. That microphone is having some weird issues, so if we're trying to figure out if it's because something's too loud or too soft, but either way, it's gonna be something we're gonna have to talk to IS about.
Okay.
So we're recording backup audio there. So at least for the future presentations, we'll have that. And when here's the recording, you can sync those.
Okay.
Clear audio.
So is it gonna remain in that chair?
Yeah, probably.
Okay.
Because the problem, we don't know where the person's gonna stand,
Yeah.
so we wanna make sure we.
Why don't we just slide that small table over here and pick it up? Cause that's out of camera range, wherever it's out of camera range.
Yeah, you're right.
How about we do that?
That's a good idea.
Cause somebody's gonna pop that or move it.
But like right here.
Maybe like right in here, yeah. Just out of camera range.
That's part of the weekly weasel, right next.
Yes, she can help another employee.
Okay.
You got her contact information, right?
I don't think I do.
it's off here somewhere.
There is some contact information on there.
And do we have a specific, benefits person?
Mhm.
Oh, we do?
Mm-hmm. Yeah, you call and to let them know, you're with St. Charles County and that person will help you.
Okay.
Yeah.
That'll work.
Yeah. Did you have a specific question that you wanted to ask?
Probably some detailed questions and I'll probably.
That will help you, yeah.
Okay, thank you.
How are you?
Good.
You thinking about retiring?
Always thinking about it.
Yeah, I know exactly. Me too. I wanna enjoy a little bit of I don't wanna work till like broke.
Right.
Yeah, 'cause I remember that with him
Nobody does.
No, so
last
you never
year.
know when your days are numbered, so I'm
Like,
like,
I'll come back
Yeah.
sometime next year.
good, I'm glad you're.
How are you enjoying things?
Time
I am. I got 11 grandkids and,
So.
Wow.
yeah, so I got enough to keep me busy and I got all kinds of projects, so, especially since I got an old house, I'm always doing something.
Yeah.
Yeah, so there's always something going on.
If you send
How about you?
Are you still at the police department?
Actually, I'm at the PA's office.
PAs?
Yeah, so, yeah, and I like it, I mean, I like the people I work with, and most of them, and the work's not bad, it's just, you learn a lot about the business.
because I just didn't know if it was just schedule to see.
How about you, how's things going for you?
Not too bad.
Yeah, they
Keep
won't
busy with that.
Well,
Yeah.
they may schedule
A few more.
I don't know.
Yeah,
I've never had to
And,
schedule it.
a few more projects kicked off.
oh, good,
Yeah, so it's,
You know, I got
good.
yeah, well, good, glad good.
they already like
Yeah, good to see you. Take care.
now, so I don't know if there's.
It's always a good idea to recalibrate
Right.
every year to 2 years. Especially
Yeah. Oh, man.
Just kidding.
Oh, it's about time.
Is it? I think it's 11.
Oh, is it 11?
Yeah, we didn't take breaks.
It's power through.
Champions.
Corey, I am at the front door and I am walking right now, Corey, walking from the back of the room towards the front of the room. Currently, I'm under that one mic. I'm now almost under the projector. I'm speaking at a normal speaking volume. I'm in the front of the room. I am now facing that microphone. Check 1, 2, check 1, 2. We can use this as evidence when explaining what we think the problem is. I'm now gonna walk from this side of the room where the projector is back to the door, and you should be able to hear the difference. I'm speaking at a normal speaking volume, maybe that's slightly above, but just about at normal speaking volume. I'm now back under that first mic that we think is good, walking towards the exit, walking towards the exit, walking towards the exit, 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 exit.
He just does that all the time.
Just walks around talking to himself.
Ian, stop moving. What now, Corey? What do you want? Go back. Right now, you're in between two microphones, and there will be about a 5-second delay until you hear that.
She's gonna see this call, she's gonna think that's unusual. I'm sorry. So, but she's gonna respond to that phone call.
Yeah, and now I'm gonna go stand directly under the microphone that we think is bad. What I'm doing right now, so 5 seconds from now, you should hear it. So I am talking right under this microphone at a normal speaking volume. I'm speaking to my friend Corey. We're gonna get audio levels right under the projector microphone.
mean, if you feel like immediately.
Okay, I will do the same thing up here at the projector screen itself and see if there's any change. The light from the projector is blinding. It is the brightest light I've ever seen in my entire life. Okay, so it definitely has to do with the zones and the pickup pattern of the microphone. Okay, so this is an IS problem. Okay, well, we have evidence. Hold on, what time is it? It's 10:30, we started at, right around 9, at 8:53, so about an hour and 30 odd minutes into the live stream, we should be able to clip this. Okay, well, we'll hang out here and load up the next presentation.
You know, the thing is, I don't.
Mm-hmm. I reminded Ray, so.
But.
Mm-hmm. We've got it, yeah, we've got it on a little table right in front of the podium. You can see it? Cool. Oh, well, you have no idea how odd it actually looks in the room, so. Yeah. I think it's fine. Yeah. Okay, I'll talk to the speaker and see what we can do. Yeah, that doesn't surprise me at all. Okay, great. Bye.
Seriously?
Honest to God, I couldn't get, I used a dollar bill, and two of them, couldn't pay it, I kept spitting it back out. Are you sure? Mom always takes care of me.
I've got extra.
All right, that'll work. I love Cheez-Its too, so thank you.
Just in case.
Yep.
Ashley gave me coffee for this morning.
Cool. Sounds good. We've already started making Christmas cookies.
Well, maybe if we have to do them. Through yours, you want some?
I have to, but
Oh. I eat breakfast so early, by this time in the morning, I'm usually ready for a snack or lunch or something.
so you let's have office part of the concourse issues or something.
I think the roof issues are one thing. The locker room may be,
Coming.
and down in our offices is a separate issue. Now, when Courtney heard it in the wall, that was because of the ATM above there. Her water was there for that, but where Rena's, yeah, it's coming from the concourse, which we keep cleaning up that water around that ATM. But Rena's office is not coming down, it's coming in the same as the concourse. Heck, my gut,
It's actually
dirt, that's where,
but is there like a concrete wall, drywall walls? I don't know.
I don't, well, there's some kind of a frame back there, but it's coming in from the ground, some above and down below, I don't know.
Tear out those walls. And
Oh, we just gotta keep
but
that.
I know, well, that's what I suggested.
Right. Yeah, you said, no, they have, we don't have staff to do that. We gotta get some engineers in there and figure out what is causing. I mean, Steve's seen it, she told me, you know, we had that conversation with her, with Brian, sitting there months ago. And she's given all the suggestions and all that, but
Not smaller crowd than we usually have. Sure, anywhere you want.
we had such a lot of rain. But the problem's getting worse. Oh, I'm sure it is. Marina's lost. I mean,
If we bring the staff on.
yeah, I mean, that's the problem. I don't like do it. Well, they're working, you know. Yeah, we could do it, I mean, we did it with the paint.
Here's, okay, Ray will be down at Water Till to get you all hooked up.
Super, super.
Okay.
Thank you.
4 minutes.
I don't know what to do, hey, help me. Not gonna.
Here's what?
Okay.
No, it's not gonna go away. No,
See that
I just,
they have
they had
different
chicken and
sandwich
something.
and then I got suits.
Here you go. I mean, to pick the carpet up, I don't know if we would have.
take everything out. You gotta be able to move it around and cut it out in pieces. It's glued now, I'm sure. Then where do I move it so she can just work it apart?
Just depends on their, whatever their intentions are.
It's gonna be whichever attack, cause it's either an external attack where they dig up the side, get in there and reseal, or they go into the walls, do it from the inside.
I honestly think.
So what's new, Mary?
Yeah.
No, but I don't know if the inside is gonna solve it. Cause I've heard people that get the.
Oh. I recognize that on.
Yeah.
Man.
I'm using them all.
I don't know the answer.
Okay.
Super.
Okay.
The envelopes lasted longer than the organization did.
Way long. The organization didn't last a year.
There's no doubt.
Make sure it's turned on.
I mean, I know it's on.
Every once in a while, I think about some of them. Yeah. You know, some of the board members and that off that.
Yeah.
I don't, that's.
Like going back to the old.
Or should be your recommendation. I'm not trying to pass it, get out of it.
The one I really liked, it was a really good guy, was Hal Barch. The guy, I didn't know about him dying until
They would.
Yeah. Oh, yeah.
it really.
It's like I'm trying to think.
Yeah, we didn't do that.
Say what?
Bob is still there.
I know her husband.
Help us with this.
Didn't she move to like?
I can't remember what happened to her.
Something that she forward.
I was thinking.
Gotta give you a little.
He died.
To think about.
She moved to be with
Yeah.
me.
Yes.
And I thought I heard something through NPR where she.
Thank you.
And then I have one more question. Are you kind of a walk or do you
Yes.
tend to stand still?
Richard still.
So if I can
As far as I
ask you to do me a favor.
But
Well, you've got ceiling mics, but they're not, this one is not performing the way we found it.
okay,
So we put this here, and that's just gonna record in general.
okay,
This is kind of under the
Springer,
He was in Fallon.
okay, okay.
All sound good?
Sounds good, sounds good.
It's way
Okay,
above.
all right.
It's because of the.
Thank you.
He's not the director of parks. He became like an assistant city administrator or something like that.
He moved, I was saying, he moved to something else. She
No.
Yeah,
took over.
Cindy got.
And I don't know if she's still.
Pretty good with.
She retired.
Doing that older. She's like,
If you pass the security test.
I don't want this down.
yeah, it's
Well, also, that's where it's.
And it's, I don't figure, I knew.
The favorite person.
I left.
I knew the office would be wet.
Let me see if I can.
The favorite person.
Okay, okay.
I can't believe it. Man,
yeah. Oh, God, no, I never heard from him.
Well, I
He
just
knew I
thought
didn't
you might
like
have
him.
heard something.
He knows I don't like
A
him.
knife
but whatever.
No,
No, I just thought maybe a scuttlebutt or something.
no, I don't.
through like eyeballs.
I guess Betty's doing okay.
I mean, she just texts us like, Dennis, she texted something the other day, Dennis to Jonathan, not to Laura. She replied back. Oh, he puts, I don't know, Legends lanterns down.
This is an Xbox, it's gotta get approaching. It's gonna cost money.
I was like, what I'm doing, and Betty was like,
He tried.
where she spent a lot of time.
Says, about.
It just started in her office, 6 months.
Yeah.
In the one.
We neither one of us.
It's not coming down the wall.
She had a sister.
That's in Illinois.
Cause I was in, yeah, years and never had such a water.
Nobody's listening to this part, that don't tune off.
She's pretty much helping him and
Saw she threw.
her sister-in-law, she goes up and helps her farm and stuff.
Cause she'd always go up there for holidays.
Yeah. Having some kind of something, I don't know. He wasn't doing well, so Tony and him went up, Tony and her would go
I was in my office. I got a
stuff.
See, I didn't even know Jeff had retired from St. Peter's. I called over there.
Jeff, Huster, yeah.
I called over there a couple of years ago and I said, Jeff's no longer here. I'm like, oh, okay. There's something, I was gonna talk to him about
something to say.
your system or
I
something.
mean, I was
Probably the registration.
at the water.
And then I got talking to the guy over it And we had some conversations.
Anything else?
It was when we were making our switch back to rec. And they were looking at something like that. But they decided to stay. And she did not like that decision.
Yeah.
I think she was getting ready to leave soon.
Yeah.
Partially because of that, but
I'm guessing.
just with all the.
But no, I mean, she told me there's found it laying up.
So the other day,
And kept cleaning, we kept the machine up all day, Monday and Tuesday, kept cleaning the water there. It wasn't then, it was
The damage was done.
the water in her carpet last night, but she sent us an email
And they're
saying when
both-
she picked her purse up.
it's like it's been almost 5
The handle of her purse
Yeah.
was.
But I went in there this morning, as soon as I got in, took a zoom in. The only place that's wet is under that credenza on that back door. And the carpet wasn't like sopping, it was just
Oh, Marilee?
there. And that came.
I was thinking about that the other day.
Is what I think. Hers was so good, cheap.
She's younger than we are.
So we didn't.
She's younger.
Never been a lot. I was feeling.
She wasn't looking good.
And I didn't have a real good.
I do.
Well, I don't think she ever was throw break. I don't think she ever threw.
But yeah, I remember I left it.
Go in there.
Got there at 3 in the morning.
Oh.
When I was out there, I checked all the.
And this, I don't know if she does this too, but she definitely does this.
Conference
I
room.
would have
She
thought.
was like almost a chainsaw. She was,
As that voter.
she kind of.
Yeah.
He just, you're really bad.
But,
And that.
no. Because there were some kind of some comments, because Richard,
Oh,
she came in.
So they're waiting on some.
There's a director from St. Charles sitting in my college again.
Did she run over the,
Different director.
because how long would she have known?
Well, I know.
Feeling really bad about
Yeah, she must have.
Yeah, I can't keep up with them.
I should call you.
Yeah.
Sure.
City
I
and
didn't-
my whole thing is something.
That's in the office.
She was a drink lot. He can't, he can't buy it for me.
I could buy you.
I couldn't keep up with him. I can't keep up with him. Because he drank from the line.
I thought Ryan had cut back on.
He had, but he gets.
Cause he was cleaned up work.
He reverts back.
He was out with Dijon. But up with her insurance rate, he's on with it.
Hey, did you get the office?
Yeah.
Okay, did she come over?
Others in their network.
Okay, yeah, so you got it all cleaned up.
It hasn't helped.
Actually, it has.
Okay, how bad was it? Was it all on the carpet in her room? Okay, all in that back left corner? Same place? Yeah, no, okay.
Oh, no, he went to the Kansas City Chiefs game one time.
Yeah.
Yeah.
They came out, what, 4 or 5 feet?
That on, and then couldn't.
Okay, well, thank you for attacking that.
Okay.
Alright.
So you, usually maxed out.
Vacation
days was this year that I think you've used.
Okay, cool. Alright, thank you. Bye.
Just so I know, that's all he was doing.
No, he's on vacation. He had-
She's there, but what, it came out, in the corner.
And I guess I'll see it too.
Oh, yeah. Oh, that's right.
Sign that for me?
That's what I was trying to
This
figure
is
out.
during him. They,
It was up
yeah, so
past
just the hospital field dropped out.
He's already cleaned it up, got fans,
Oh.
still
So-
spraying carpet, you know,
Maybe got shit.
stuff in.
Well, sure enough, and I said, who's this there outside your door in here?
That, I mean, that, I'm
They're
not
filling with air all.
putting lights.
I said, I can't. I said,
No, we can't.
No, something's done. They got like,
They in.
dude,
Yes, I'll-
So you're gonna be.
Green is still there.
So just,
Annie. Joe said, well, just pick it up. Yeah. It's up here for you now.
I couldn't.
It's up there.
So I gave it.
So she gave me a bag. She got me out of my hankies.
I just, she wants some Jesus, I brought it extra. And he.
No, I'm good, thanks. I eat a piece of cough drops like candy. Cherry ones are good.
They're more like kindergarten. Preschool. So, okay. Even though it's big, it does get much. Yeah, it's kind of like. I just kind of love it.
You guys have a full page. Those guys.
You call Coach Jody.
That way it's higher.
Cody's and I might see familiar faces. It's good people.
Hey, how you doing?
Oh, okay.
Will this really go?
I'll do is, I will do it. Tell you that?
You got those.
It's full, but if there are questions. These are sides of him she doesn't know. Hello.
How are you?
I'm fine. How
Good to
you
see you
doing?
again. Good.
Good. How you doing?
Hanging in there? Joyce, how you?
Hey, Steve, how are
He
you?
does it every morning.
What's up?
Let's bring something in.
Oh, no, this was for lockers. No, yeah, I don't know that they got anything for,
This is easy. He leaves it for Judy. That's important.
I understand.
Yeah, anything.
Smoothie game. He leaves it for smoothie.
They have a handbook back there.
She's drinking energy.
oh, good. Well, you know what, I think I got one mailed, cause see, I already
Charles Campbell.
signed up for it only because they said that if I waited this my monthly payment for academy study.
Some of his.
So I already signed up, but I'm concerned about after, when I get the job done with accounting, what supplements should I should get?
Ceiling mic isn't working. You have to close to, yes.
Oh, do they?
Sorry.
You do.
As I said, guy that was telling me everything, I said,
Well, then,
oh,
then I
it
don't want to
doesn't
cover
cover
it
up
up.
because I've always used
So,
it.
yeah, I know that I spent they, now I have that, and I have other options, other things to buy.
Definitely, we used to.
That old.
Do they? This one seems they do everything.
No, I used to finish with the log.
Give you the list. We spent, I went through all the John stuff. Right, a year we quit doing it. Back in children's person we got.
I'm used to
The lab, that guy definitely said, you know.
Oh,
like,
yeah.
that perfect.
time.
We know what's wrong. It's not kind of like these people, like this is this. And so we're the.
This was all, like, this was open to county employees, all the cities who had
Oh,
logs. So yeah, there was like 30 people and they like knew who I was and they not sure if that's good or not.
yeah, yeah, it's like.
Which, by the way, submit their paperwork
they
as
do
you
something.
can.
Scarf.
Where
Everybody knows like did it with lab. And we would go to the
spousal, I knew
On
about.
Monday.
it was pretty cool.
Yeah,
To turn it in because of the
yeah.
Unless.
well, that's right, you said you were. Can you do it?
You need it.
Or you get into kind of like have some health issues.
You need to do
Bought all
it
these,
earlier.
and so we need.
My dad's 89 and not
Oh, there you go.
Because
what I
that's
can
the
get from
tape
loggers.
full of this information.
You want it to last as
If
long.
I had
Put it on your
20
phone.
years,
But
yeah, I'd like to leave 63.
Amy was, she has to work both days this week.
What you join us?
Yeah.
Thanksgiving.
Especially
And
since
I'm
we don't
like,
put
I
any
need
in.
it turned in, and I can't turn it.
It's really based
Approve
on.
it. And
I'll try to get,
In terms of servicing your best.
those three.
We all.
I still have
The
all the
longest
still-
personnel, everybody. Good rate.
Yeah, the last, well, yeah.
just say, hey.
And the phone numbers, everything.
You kind of have an outtake.
I do have a 90. I'm getting to the point now, and I've never disliked coming to work. I've always, I can't say that I've always enjoyed some of the stuff,
Yeah.
but I've never disliked coming to work. And, to be honest with you, there's not any place else that you can get the flexibility that we have.
Andy,
Not,
dating.
it's very,
My friend, I'd like to leave just
I
about
get,
before my
I
signature.
get, it comes to my level.
Like to work. I've got
We don't wanna go. I don't wanna go.
They,
I like what I do.
friends.
and even if I
We
submit
can't
it,
find
But it's like there ain't no job out there that does it. It also.
Like, we can't find anybody.
well, that's true, that's true.
The supervisor should be able to see.
they have cancer.
Oh, like Delaney does. Well, I don't know, Delaney got sucked in with water.
Sucks into working full time.
There's no.
Yeah, yeah.
He's not.
Clocking in and out.
He's working this.
Good
Somebody
morning.
going in and.
If I can.
Well, it's on.
Oh, God.
Hello, good morning. We're starting.
Good morning. Yeah, gee, I don't know.
Exempt, they walk in and out. That's why.
All righty. All
Pretty good gig, really.
right. Well, again, good morning. My name is Wilma Schmitz, and I'm the regional liaison and trainer for the St. Louis area with Missouri State Health Insurance Assistance Program. And what I'm going to talk about is Medicare. If you are about to turn 65, you have the option of joining Medicare, and you'll get all kinds of mail from all the plans that want to offer you the best, they say, the best information available, best coverage, and they have a bias. One of the things I can say is that the Missouri State Health Insurance Assistance Program does not have a bias. We have no skin in the game. We don't get any commission from helping you. We actually receive our funding through the federal government. So what you see on the screen right now is the number one question is, you know, what kind of Medicare should I take? It does depend. It depends on your circumstances, and I would say that most people in this room and listening actually have a different need from their colleagues. So please, friends, relatives, co-workers, strangers on the street may say to you, what they have is the best thing since sliced bread. It may not be that for you. The Missouri State Health Insurance Assistance Program, better known as Missouri SHIP, used to be known as CLAIM. So for years, for 30 some odd years, our name was CLAIM. And then in 2023, all the state health insurance assistance programs in the nation, some decided to have that name. So when you hear me say SHIP, and if you're looking at a teleprompter or a reading device, it may not come out as SHIP, and I apologize, but I am trying to overpronounce the P because of words, okay? Thank you. Somebody got what I said. And I was trying to say it so I wouldn't get in trouble. Okay, we are funded by the federal government to provide, and state government, to provide information to people about Medicare, because Medicare is so complicated. It changes every year. So we're gonna talk about that. We're part of a network, so every state and territory has a SHIP program. So one of my favorites is the Ohio SHIP, because their acronym is truly O-SHIP. Right? All right, now you hear it. Okay. Our phone number, 800-390-3330, is the number you can call and get a referral to talk to a counselor, hopefully located in St. Charles County, to discuss any matters that you have, okay? So we go out, we do Medicare 101s, we actually do right now is open enrollment, so we have counselors at the St. Peter's Senior Center they're actually doing in-person consultation. So call, tell us what you need. If you need to have in-person, we have some super people in St. Charles, okay? So we help with enrollment. I am a teacher and I did not explain other than my title, but this is my 43rd year working in the field of aging. So my master's is from Lindenwood and in gerontology. So this is home to me, St. Charles County. So we help people enroll, and being a teacher, I will ask people different questions. Does anybody know the first step to enrolling in Medicare? I have puzzled faces. Okay. You've been working for many, many years, paying into Medicare. The first step is to enroll with Social Security Administration. They are the gatekeepers for Medicare. There are no Medicare offices open to the public. Those are, but Social Security. And you can actually go to ssa.gov and set up an account. You can do that even if you're not close to retirement. You can see what your estimated Social Security payments will be, and that's also the site that you can start Medicare, okay? Even if you're working past 65 and then you decide you're going to get into Medicare, you can do that there, and you could call us. We'll also talk briefly about supplemental plans, and those will take care of the expenses, medical expenses that Medicare does not cover. Okay? Got a question looking? I look at faces, so when I look and you've got this big question mark on your face, I will ask, or I will clarify, because not everybody wants to talk. But does anybody have questions so far? Okay, well, I'll keep going. So the supplemental plans, also known as Medigap, are available. There's also Medicare Advantage plans available, and that's the ones that you have received mail about, that you have heard about on commercials, you name it. That is something we'll talk about. And then we'll talk about how you can get benefits if you have very low income, and you may not have that, but you may have a family member that has not applied, because we have a large number of people that are eligible and have not applied. So let's talk about this. Would you say that's a fair statement, that Medicare is complex? Medicare has been around since the 60s. The very first person to receive a Medicare card was Harry Truman, because he had no health insurance. He and Bess were really bankrupt when they left the White House, because they didn't have the pension and all that that presidents have now. And Congress has always had coverage. Presidents, not so much. So it's complex. If you're sitting next to someone, they have a whole different need, and they may have registered already, and that is different. Okay, told you, first step is to go to Social Security Administration, and for folks that work for railroads, they have a separate but equal retirement board. So when you turn 65, you're eligible to sign up for Medicare if you've worked 10 years. And there is a record number of people turning 65 now. 15,000 people each day become eligible for Medicare. So if you've tried to call the Social Security office, that's why you get up early, put it on speakerphone, and you do everything that you need to do, because there's going to be a long wait if you're calling. That's why they're encouraging everyone to use their website. Okay, Medicare. Medicare has multiple parts to it. And we're going to talk about those parts, and we're going to come back to this diagram. So Part A is at no additional cost to anyone that has signed up for Medicare and that has worked 10 or more years. It's the least used in Medicare, and it takes care of 80%. So if you were to go to the hospital and was admitted, 80% of your bill will be covered by Medicare. It's the percentage, the 20% that you have to pay that can run up multiple thousands, if not millions of dollars. So while Medicare is wonderful, it does not take care of every expense. So hospital coverage, psychiatric coverage, if you go to the hospital and you're discharged to a rehab facility that may be in a nursing home, you should realize that you will not be there long, and you won't be a permanent resident unless you need to be. You cannot, and people cannot move you to a nursing home without your permission. I bring that up because someone recently said, well, my kids said they're gonna put me in a home. And I went, oh, no, they have to have reason, okay? If someone has dementia, they may wind up in a nursing home. But if it's just because the kids say, well, we want the house, we want your money, you have rights, okay? Just saying. My kids know that now for real. So let's talk about, that's what skilled nursing means. When we talk about home health care, that is when it's short term, when you've been discharged from the hospital, but they want to make sure you're okay at home. Maybe you have a walker and you have to learn how to maneuver that walker at home, like for cooking. Hospice care is end-of-life care. Hospice does not kill people, Okay, so I should say myths and truths at times. But myth is hospice kills people. Hospice is a way for a person that is terminally ill to have the best quality of life possible without pain. So hospice is a underutilized thing. Yes.
I just want to comment on that. My mom just went under hospice care. She doesn't have any, she's not real quick, but she went under hospice care and she's in a nursing home and they are actually checking on the care she gets from the home on a weekly basis. So it's actually kind of improving her care.
Yes.
The nursing home.
Yes. And that's so that if someone is considered lack of thriving, where they're just, something's going on, it's usually called palliative care at some point. But when someone is declining and there is no illnesses associated with it, they need to just be monitored and they have more attention when they're in hospice. And yes, you can get kicked out of hospice, okay? And that means the person is recovering well, and their weight has increased, their output has increased, the kidney functions have increased. So that's something to look forward to, and congratulations to you and your mom for having that coverage and having the people to advocate for your mother.
Actually, she's not going to get better from the condition.
She's not going to get better, but she's not going to decline as much.
Yeah.
That's the hope of
The time
hospice.
she has, they're improving the quality that she has here.
It's quality.
That's,
Everything is quality.
I just brought it up because it's a checks and balances against the nursing home care.
Yes, it is.
And they've made a lot of changes to our meds.
What they did. Okay, so again, in a hospital, if you have to have blood and they have to go outside of the hospital, you will be charged. Okay, but Medicare does take care of the first 3 pints. Okay. The most used part of Medicare is outpatient or Medicare Part B. Now, Medicare Part B is optional, and a lot of folks that are continuing to work after age 65 opt for to postpone Medicare Part B because you have to pay for it. And for county employees, your insurance, your employer insurance is as good or better than Medicare. So there's question of whether or not you want to sign up for Medicare because it's kind of like double dipping. And Medicare will be secondary for you if you sign up for Part B before you retire from the county. And there are all kinds of circumstances. So if you have an unusual case, that's another reason to call us. So think of Part B as everything outside of the hospital setting, with the exclusion of medication. Okay? Go to the doctor, go to physical therapy. Please don't go to a big box store and buy like a walker or a wheelchair and expect Medicare to pay 80%. No, everything that you do and you want Medicare to pay for has to be attached to a doctor's order. So that's why you don't want to just go and buy something and then think, oh, well, Medicare will take care of it. No, it won't. Okay, preventative services. I actually have a booklet in the back, and I'll make sure that Debbie and the HR team has a link for people that are watching live stream about preventative services. Most people don't think of preventative services, but you should, because Medicare is trying to make sure that you have the best quality care. So by doing that is to prevent, like you can have flu shots, vaccinations are covered by Medicare. Even RSV and shingles. So if you sign up for Part B, and I think your insurance covers it too, for folks that have Part B, they can get a lot of preventative services. The last point on this chart or this slide talks about the moon. You know, government loves to talk in acronyms. So MOON stands for Medicare Outpatient Observation Notice. In other words, if you go into the hospital, you're in a hospital bed, in a hospital room, but you're only there for 24 hours for observation. That goes under Medicare Part B, not Medicare Part A. Okay? So I suggest and recommend folks have a family member go with them or a trusted person to go with them if they have to go to the hospital. If you go to the hospital, that means you're in pain. You're good to know your name. Think if you've ever had sciatica, you're just praying for something quick to stop the pain. Or a urinary tract infection. You are trying to remember who you are. If they did a test on where you are, your age, and your mother or father's name, if you're in pain, you don't know. You're so concentrated, and that's why have someone with you, okay, if all possible. There's an initial enrollment period for people that want to sign up for Medicare. 3 months prior to your birth month, your birth month, and 3 months afterwards. So that means that you can get in touch with Social Security via ssa.gov, say you want to sign up for Medicare, and you can have your Medicare actually start on your birth month. Okay? If I say something that does not make sense, or you want clarification, please stop me.
Can I ask?
Yes, yes.
What did you say, if they're receiving Social Security, they're automatically enrolled in Medicare? No, okay.
No, Social Security, for people that are turning 65 right now, the Social Security, when you receive Social Security, will be enacted when you're 67 or older, okay? But Medicare starts for everybody at 65, and you need to notify Social Security, so they will tell Medicare yay or nay, okay? Other questions? Clear as mud a bit, okay? So there are special enrollment periods. And if you work for the county longer than age 65, let's say you're going to retire at age 67, you have a special enrollment period if you want to enroll in Medicare, okay? So you will have, let's say you're going to retire. First of all, you get in touch with your HR department. You should become very friendly with HR because they're the ones that are going to help you maneuver into Medicare and Social Security. So there are letters that everybody is to receive every year that says your coverage, okay? The county has credible coverage to Medicare, which means that the county plan for active people is better than Medicare. So I encourage you, if you're going to work past 65 for the county, to keep informed of what Medicare is, how Medicare can benefit you once you retire, okay? Had someone recently ask me, a county employee, they're changing their status from full-time to less than full-time. And the insurance, to stay on the insurance was gonna cost more for them. And they asked, well, what should I do? And what I said to the person was that I will send information, and it goes for everybody for the county, how you can decide whether or not you want to sign up for Medicare Part B and when, or if you want to stay with the county plan, okay? So it is complicated, it's very individualized. So you want to make sure you know about the special enrollment period. There you go. If you decide to sign up for Medicare, your work employer insurance will be first. Medicare will be second. Medicare wants everybody to figure out how to pay their medical bills through other insurances before coming to Medicare, okay? And they don't play well with other insurances, okay? They don't even talk to the VA. If you're a veteran, thank you. But also understand that if you have veteran, you use the VA, you may not want to use, depending on the policy, what your circumstance is, you can't go to the VA and think Medicare is gonna pay for your care, because they don't talk at all, period, okay? All right, here we go about when you decide you're gonna retire, you could sign up for Part B, you got 8 months. Please do it sooner than later, because later there's penalties after 8 months. COBRA. The reason that COBRA, and I forget what the acronym stands for, but it kind of sums up everything. COBRA is a snake, right? If you decide you're going to go with COBRA, understand that you will be paying for all of your health care insurance, and that will bite you, okay? COBRA's expensive. Yes, sir.
The 8 months on the special enrollment period, when does that start? Is that when your coverage ends or before?
It is when you decide you're going to retire.
Okay.
And that's prompting you to go and sign up for Part B.
Okay.
Okay? Okay? Other questions? All righty. Okay. For those that work for the federal government, there are special provisions for them as well. And then something that I put this little red arrow. You should consider each option you have, no matter, if you're going to go to Medicare, because you want to have the best coverage. Medicare may not be the best coverage for you. Okay? If if a person has a health savings account, if you're going to retire and you know you're gonna retire, you need to stop paying into HSA. Use HSA. Use the money you have set aside, because if you continue to pay into it, when you've decided to retire, you will be taxed. The whole idea is to stay away from taxing. And I noticed that one of the slides when I walked in didn't talk about HSA, but about FSA, which is totally different, okay? All right? TRICARE for life. If you have TRICARE or have the option of getting enrolled into TRICARE because you are retired military, please check with their office, because TRICARE can be and is better than Medicare benefits. So if you have a family friend or if you're a TRICARE for life person, you want to call TRICARE to make sure you keep the coverage that you have. Do not, please do not answer the phone and say yes. When they say, is this Mr. Jones? If Mr. Jones says yes, a scammer or agent or agency can clip that response and sign a person up for services that they don't want, don't need. And the reason I bring it up when TRICARE comes up, person lost their TRICARE because they saw on TV where, you know, you can get extra benefits, gym membership, and all that. Person called without the spouse's knowledge and lost their TRICARE, because that would be double dipping. Okay? So please be cautious and warn family members as well. Don't answer the phone, say yes, because we may not be able to get your benefits back. Okay? Okay. Those were the special circumstances if a person has special employment and retirement. So we're going to talk about Part D. Part D, well, slide's messed up. Okay, we're going to talk about supplements. When Congress approved the Medicare Act, what they said was Medicare will take care of 80%. It would be left up to you to pay the 20%. When Medicare was enacted, MRIs weren't being used. Heart, lung transplants weren't, they weren't around. Think of all the technology we have now versus back in the 60s. Tremendous change, which means that 20% is very costly. So how do you take care of that 20%? That is one way to do that is supplemental or Medigap. That's where you pay one fee a month in addition to your Medicare Part B, and you could go anywhere in the country to see a doctor, okay, to get services, anywhere, okay? And Medicare stops at the border. Please remember that. I mean, step aside real quick about traveling. Medicare stops at the border. If you go to Canada and break your ankle, you're going to have to pay Canada for your medical care. Had a person go to Canada, broke his ankle, and he was astonished when they would not wait on him until he showed them that he could pay $3,000. Luckily, he was able to put it on a credit card. He was upset. He goes, but I have Medicare. And Canada said, it stopped at the border, and it does. So if you decide to go to Puerto Rico, Medicare will cover you. Alaska, Hawaii, you know, they're states, okay? Go on a cruise, when you step on that plank, you know, that boarding plank, that's where Medicare ends. So get traveler's insurance, okay? Another client went on a cruise, came down with COVID. They had an ICU on the ship, and she got a bill for $10,000. Medicare Part A took care of some of it, but she owes the cruise line $8,000. Okay? She didn't have Part B. She didn't have a supplement or a Medicare Advantage plan. So she has to make arrangements to pay that. Okay? Stay insured. Okay? If you go to, let's say you have a disease and you go to Mayo, you want to go to Mayo Clinic to get a second review. With a supplemental plan, you will be able to go to, okay? And I'll tell you some disadvantages of some others. Okay, open enrollment, and let's say that you're diabetic, overweight, high blood pressure, and you are about to retire. You look at a supplemental plan, and guess what? They have to take you. It's called guaranteed issue. That is wonderful. And that's why the government also prompts you to make decisions that you can live with. Okay? So it's a guaranteed issue. And Medicare is not a family thing. You know, you may have coverage, your car insurance may be a family thing, not Medicare. Okay? It's individualized. So we're in the middle of open enrollment right now for Medicare Part Part D, and for Medicare Advantage. There is not a open enrollment for Medigap plans. It's based on the person's, when the person purchased the plan initially, okay? All right, there is a website for Missouri, insurance.mo.gov, seniors, Medigap. And there you'll be able to get not only a booklet, but you'll be able to see the different rates. And when you look at what's called the Shopper's Guide, you will see that there are plans from Plan A through Plan N. And there are several companies, when I say several, there are many companies that sell these plans. And let's look at, for example, Plan G, very popular. There are at least 24 companies selling Plan G at different price points. People say, well, that does not make sense. And I say, this is called choice. People buy plans because they may have their auto insurance, their home insurance through a company, let's say State Farm, because that's one of the big companies in Missouri. They may give you a discount versus a company that doesn't, you know? So, for example, one of the most popular, and some folks that have been here for a while, that have been here before, don't answer this question because you been asked this question. When you were growing up, can you name an insurance company that you have been aware of since you were probably 6 or 7? You watched a TV show on Saturday or Sunday, and it was all about animals. And the, oh, thank you. Thank you. Okay. Wild Kingdom. Mutual of Omaha. They have been marketing to us since we were little kids, okay? We know them. We know if I did this, cupped my hands, what company? Allstate, okay? When you turned 50, the very first birthday card you got was from who?
AARP.
They've been marketing to us for a long time, okay? They sell supplemental plans, okay? Not sure about Allstate, but I know the other two do, okay? So you want to compare. What are you comfortable with? Is price important to you? You want the lowest cost? There's a plan. You're familiar and you have discount with your homeowner's insurance? That might be there. So you need to shop and get familiar with everything before you have to do anything, okay? Okay, Part D.
Can I go?
Yes.
The no open enrollment period on the Medigap, that's because it's not for that set period, it's whenever you originally signed up for it. So you're not locked into the same plan, you can change, it just has to be in that
when you
year.
purchased it. So the question or the statement actually was that when you buy a Medigap plan, you are locked into that as an anniversary. So if you purchased in August, in July, you will find out what the premium cost will be for the coming year. At that time, and thank you for reminding me, in the state of Missouri, we have an option to go and look to see if we want to change the anniversary month, not open enrollment for Part D.
So the open enrollment period has nothing to do if you're on A and B with Medigap, right?
That is.
If you're enrolled.
Has nothing to do with, open enrollment has nothing to do if you have A, B, and a Medigap. Except you have to have a Part D. Part D, medications are expensive, right? Okay. Let's go on. Did I answer your question, I hope?
Yeah.
Okay. Part D, drugs. Look at that very first bullet. Anyone that has Medicare Part D for drugs has a cap for all of their medications covered by Medicare at $2,000, okay? From now on. We've talked in past years about the donut hole, it's gone. There are people that may hit that $2,000 because of their medications in February. There are options where you can pay every month according to what the plan says, so it could be pretty erratic. Or you can say to the plan, I want to pay a little each month to get to that $2,000. So the person can budget their medications. Okay? Big thing, big change. Okay? This is as big when the government started negotiating the cost of insulin And people now, instead of paying $3,000 a month for insulin, it's capped at $35 a month. So that is a big change, and with that change, we're also seeing premiums go up. The plans are saying, hey, we gotta make money, so premiums have gone up. Okay? You can use any pharmacy that accepts Medicare, but you have to live for Part D, you have to live within an area, their service area. So if you were to go to Hannibal and you had a Part D plan here, you have to, and you were gonna live in Hannibal, you have to re-enroll into a different plan because there are different costs according to where you live. Okay? So you can go to Medicare.gov. Make sure you go to Medicare.gov rather than Medicare.com. Medicare.com is an insurance agency. Okay? Medicare did not lock that name down. Okay? All right. And, there are preferred pharmacies and then there are standard pharmacies. But on Medicare.gov, even now, you can go and use the plan finder and look at what your cost would be according to Medicare regulations, okay? If you were going to be on Medicare Part B. It's optional, but just like with Part B, if you don't sign up when the initial time or special enrollment, you will receive a penalty. Okay? And so there we are, okay? There are special enrollment periods for that. So let's talk about Medicare Advantage plans, better known as Medicare Part C. And if you ever want to, there is a document that you can call our office and we will be happy to mail to you. It's the Medicare and You book for 2025. Okay? In this book, there are, and each state has their own book. So if you have friends and family in Kansas and they say, well, this is what my plan says, why doesn't yours say that? It's because they're written by state. On the back of this cover, you will see a very familiar phone number, and that is to our organization, Missouri SHIP. So that's another way to know that we're legit and we're not insurance agents. But this chart is actually in the Medicare and You book. And we're going to talk about Medicare Advantage plans. Supplemental plans were too expensive for folks. So Congress came up with Medicare Advantage plans. Lower out-of-pocket costs and restrictions, meaning networks. Okay? One of the things that you have to stay within network. And for example, all the Medicare Advantage plans are written for folks in this area for the St. Louis metropolitan area. Okay? Again, if you go to Hannibal or Kirksville, those plans are different up there. And one thing that we're dealing with right now is in 2025 in Northeast, in the Kirksville area, there's a hospital there that's no longer going to accept any Medicare Advantage plans except United Healthcare, okay? So if a person had a different plan, they're gonna have to change to United Healthcare or be responsible for 20% of their bill. Okay, and it gets worse. There's another hospital up in that area. After 2025, they will not accept any Medicare Advantage plans. And we're trying to figure out how folks that cannot afford a supplemental plan, how they're gonna pay for their 20%. So you see gray hair now, oh my gosh, I don't know what it's gonna be like here. So what Medicare Advantage plan does is rolls Part A, Part B, and drug plans into one nifty little package. And they have extra benefits. If you have never talked to an older person on Medicare Advantage and you ask them about the extra benefits, first thing they will tell you is they get free gym membership, silver sneakers, or United Healthcare has its own. Do they use it? No, but it's there, and that's what hooked them in. So it happens. Last year, one of the plans offered up to $1,700 in fitness equipment. So people went out and bought very expensive tennis shoes. I know at least one person bought golf clubs. The golf bag was not covered, but the golf clubs were. People went to this plan in droves because of that. Then in April, the plan said, oops, we're not gonna cover that anymore. Now, I'm still waiting to see if there's going to be some type of lawsuit, because if that's not bait and switch, you come in, we'll give you up to $1,700 and then, no, okay? So beware. Every year at this time, October 15th through December 7th, if a person's on Medicare Advantage plan, they can change, okay? And that's what you hear, and that's why you're getting mail, even if you're not on Medicare, because you're at that age, so that's why they do that. Okay. And there's the cap. Wait a minute, I'm going backwards. And I was told not to do that, but anyway. Okay. All righty, where was I? Okay, so when a person signs up, they will start, the new plans start January 1st. And you have to live in a designated area. A downside, again, if you want to go to Mayo Clinic for second opinion, Mayo Clinic will not accept Medicare Advantage plans. Barnes does, BJC does, Mercy in 2025 will not accept any Anthem Blue Cross Blue Shield. Okay? So that is what a lot of people, our counselors are working on, is getting people off of Anthem and finding a plan that will better suit them, especially if they want to stay with their doctors, okay? You want to review any type of plan, but definitely a Medicare Advantage plan. They change every year. The cost, while the premium cost may be affordable, there may not be some coverage that you need. So you need to make sure that. And this is when I do a plug for people that have older family members or members that are disabled, please look at their plan. Because the plans are changing, okay? Okay, important dates. We're in open enrollment. I have a nice little stash of chocolate. Know that around 3 o'clock every day, I'm breaking into that stash because some of the things that people are going through right now is horrendous. Horrendous. And that's what we're there to help them get the coverage they need, okay? Okay. We're different because all of our services are free, okay? We are trained by Medicare and the state. Every year, over 100 hours are offered to us. And our counselors are community-based volunteers, and we have some in-kind or staff folks that work for the area agencies on aging and other members that work with us as well. We give unbiased information. We will not make a decision for you because you are the one in charge, okay? And we are nonprofit. We receive grants from the federal government and the state. If you retire and you should have a plan on what you want to do when you retire. Because as soon as you tell friends and family you're retiring, they are going to give you a list of things they want you to do, okay? And so one of the things that we are not, we were never taught what to do when you retire. You've been on the hamster wheel for, 40 years. All of a sudden, that wheel stops. People have gone into depression because they don't have a sense of worth for themselves. So this is when I do a plug to be a volunteer. If you don't want to be a volunteer with us, which I would really like you to do, think about it. Volunteer for something, okay? Don't just sit home because you will find people that just stop and don't have a plan and just sit at home tend to weaken, and they really tend to have a shorter lifespan, okay? So I can guarantee you, we will use every muscle in your brain volunteering with us. But the joy that you get in helping people is tremendous. Okay? Call us if you have questions about Medicare. If you suspect that a family member has been scammed, let us know. We work with the Senior Medicare Patrol reporting possible scams, and they are everywhere. Speaking of communication, one of the Medicare subcontractors was hacked, and people in Missouri were affected. They received a letter back in August saying that there was a possibility, if they were on Medicare, that they were hacked. Information that was hacked: name, address, age, Social Security number, Medicare number. Medicare or Social Security is offering or will be sending new Medicare cards to those folks and giving them the option to have their credit monitored for a certain period of time. If you have a family member and all of a sudden they get a new Medicare card and a new Medicare number and you're going, is this a scam? Call us. We have a way to check to make sure that it's legit. And I had a person 2 weeks ago. What I saw on the Medicare database was different than her card. And then I had to tell her about getting a new card. Okay? Scary stuff. Okay? So, questions? Clear as mud still? Okay? Yes, sir.
It's a minor question, but it's about, we have a flex spending account here that we can use for medical expenses and that. Last year, I turned 65, enrolled in Part A, haven't enrolled in Part B. The period is what, 6 or 8 months before I go on Part B? I have to have that cleared?
Right, yeah.
Not making
You can't
payment?
pay into, and the question is, for those that are listening live stream, was it's called what now? The flex spending?
Yeah.
Yeah, okay. Flex spending accounts, you have to make sure that you don't contribute to that at least 6 months before you retire. Okay?
But you can have it when you.
You can have it, and a lot of people use it to pay for things, you're gonna need a knee replacement
Right.
to help pay for that,
Okay.
okay? Okay,
Are you talking about a health spending account or a flexible?
that's a flex. Okay, but I would say, to be sure, check with HR. Okay? Other questions? What happens when you go to Machu Picchu on vacation? What are you gonna do before you leave?
Traveler's insurance.
Thank you. Okay, travel
I've
insurance.
only been in this for like 3 years now, so.
I'm telling you, people don't think about it, and if they don't go through a travel agent, a bunch of friends getting together, oh, let's go on a retirement cruise, and they don't get it, they don't get traveler's insurance, okay? If you're turning 65 and as a child you had chicken pox, what are you gonna do?
Get the shingles vaccine?
Get shingles vaccine, because you could go blind. Okay, shingles is nothing to play with, okay? Let's see, another question real quick. You decide that you're fed up going through a health system and having a plan, and you go to a concierge doctor where you pay $5,000 a year and you have that doctor's cell phone number. Is Medicare gonna pay for that? No. Those doctors do not take Medicare, and Medicare will not pay them. That's a gamble that people are willing to take, okay? Questions? Okay, as soon as you walk out, I'm sure you're going to have questions. You're welcome to give our 800 number a call. And for those that have smartphones, that QSL, or what is that thing called?
QR code.
That thing, that square.
QR code.
QR code. You can do an evaluation and we need that, okay? So if you take a snapshot of that, those that have smartphones, you can get that, or you can get it through give our organization a call and tell them, okay? There is materials at the back, and I'll make sure that HR has a link so people can download or whatever for those that are watching live stream. So with that, I thank you much.
Thank you.
Thank you.
Check? Got the check for Lily?
Dustin is putting the other page.
Okay. Is he coming today?
Drop some to Wilma.
Yeah, finance thought. Oh. Finance thought we would do a lot of petty cash. So they gave us our own drawer because if we would clean it.
Yeah.
I got no petty cash.
Well, I told him to send
Nothing left?
ASAP.
I have to replenish my phone, I gotta find out.
And I said, Mary did us a favor, and Lily said, Mary's great.
Everybody says
Best
that.
favors or something like that.
Oh, it's
Everybody says that.
Oh,
The whole
It's the
thing.
best.
Okay, I
Please.
just took my glasses off.
Oh, okay.
She was the best thing
Oh, yeah, I
for
know that.
So there you go,
understand.
Mary.
Yep, that's me.
Okay.
I'm the
All right,
best.
you got one of those?
Yes, I certainly did.
Okay, give us a call if you need us.
Thank you very much.
You're welcome.
Yeah.
We do.
My undergrad.
Yeah.
Well, you're clearly volunteering for us if you ever get tired of doing this.
Oh, believe me, it's been so many years, but I plan to go into commercial recreation, like Six Flags type stuff and concerts. And then I had to do an internship in aging, you know, dealing with older adults.
And you fell in love with it.
Oh, yes, yes, and never looked back. Plus, I got married to a man that would not put up with arranging concerts. And I did that in undergrad. So the concert venue that Riverport, whatever its name is now, we had SIU Edwardsville, the Mississippi River Festival.
Oh, yeah.
And I did concert arrangements for that. So that was all student led.
That was a big event. Do they still do that?
Oh, heck no.
Okay.
No, that
much work.
ended in 81 or so.
And you know what? We date ourselves when we call it Riverport because we'll never stop calling it Riverport if that's what we had
Yes,
when we first.
yeah, that's what it was.
Yeah, I don't know what it's called anymore.
Go ahead and say that to a young kid and look at the face you get.
Well, you know what? I have come to the conclusion you have to have a dictionary to translate what we know versus what, I mean, like that code, you know, my kids would say, oh, well, that's up. And I'm going, too many acronyms, you
Somebody
know?
said the other day something like LOL no longer means laugh out loud. Now it means something else.
Really?
Really?
It's not LOL, but it was one of those acronyms that
okay.
you send all the time. And one of my kids is like, "Stop sending that, Mom. That's not what it means anymore."
Really?
I'm like, okay, wish
I'm
I
gonna
had known
have
that.
to, yeah, I'm gonna have to,
As long as
you
I'm
know.
still safe saying LOL.
Apparently,
Yeah, really, 'cause I do that a
LOL is
lot,
still good,
you know?
but yeah, I'm like,
My
you
sons
never
correct
know.
me a lot too.
They
Mom.
change.
Oh,
ROFL.
Rolling on floor laughing.
Laughing.
Yeah, well, you better make sure it still means that.
really, yeah, and my grandson, 9-year-old grandson can do things that I can't do.
Now, we all need to take a deep breath and realize and go back in time in our memories. And you remember when we gave that VCR to Mom and Dad?
Ooh,
Yep.
And it sat there and the time just kept blinking for months and years until you came back and changed it for them?
that's true. That is very, very true.
I like to
That's what they
say,
were experiencing then.
I like to say, I may not understand it, but I have other gifts.
There you
okay?
go.
My other gifts, and they don't have those gifts.
Yeah, give a 40-year-old a record and say, play it.
Yeah.
My mother just could not believe that my son went to the middle instead of, oh my gosh, yes. And he was like, well, Grandma, you know. So anyway,
I would say my house still has an 8-track player.
Oh.
Just say an 8-track player, show them a tape. That's a
Wait,
VCR tape.
The
No,
truck
it's
I
not.
just bought, the truck I just bought, had a AM/FM radio,
Yeah.
a CD player, and a cassette tape player.
That's shocking.
I
You
think
wanna
we
know
still have an
what?
8-track somewhere.
Yeah.
I got
Yeah,
rid of
maybe-
that along with my bag phone,
Yeah.
but my kids had to see the bag phone. Really? You called on this? And I'm going, hey, that was cutting technology.
One of my neighbors who has some small kids, she was in my house and she goes, do you have a VCR? And I said, yeah, I have a lot of old movies. And she goes, my kids wanna know what that is. We were talking about that. Can they come over and watch a movie? I'm like, yeah, sure, send them over some Sunday. They can watch my VCR. She goes, I can't believe that.
I saw a video recently where a parent brought out a rotary phone and asked his kids
Oh.
to dial.
Oh.
Well, what's
I
the
think they'll
thing,
figure it out.
what's the thing that posts all the time? You wanna drive your children crazy, lock them in a room with a rotary dial phone. There's like 4 things it tells you to lock them in the room with, and it'll drive them crazy because they won't be able to figure out how to use any of them.
You got it, you
And
got
I'm
it.
like, that's true.
Yeah,
Lock
yeah.
me in a room though with the computer and the iPhone.
Mom and Dad never had a
I
color
can't do all that
television
either.
until I went off to college, and then they finally got one.
Oh,
Never had they had a window air conditioner, but they never had central air conditioning.
it's amazing, and we take it just for granted. We take so much for
So my kids
granted.
go outside and play. See,
I enjoy your presentation.
Thank you, and thank you for the questions, because that triggered me to go on to talk
Yeah.
about something else,
Hey,
so.
I am good for something occasionally.
You're good for a lot. Take care, guys.
Bye-bye.
Bye, Parks.
See you later.
Yeah.
Oh, man.
Oh, goodness, goodness.
Thanks for coming.
My pleasure, my pleasure.
How many people did they have? Physically?
We had 11. I moved to them all signed in. So there was more than that.
Yes, and so how do we know how many people watched one stream?
I'm not sure if we're tracking it or not. I would have to log in,
Okay,
so I'm not quite sure, but it was only employees.
okay.
So,
Is-
couple.
Okay. Okay, so let's see.
Numbers, I would say probably around.
Okay, because of the sheer number of. Alright, so,
Yeah.
okay, thank you.
Thanks a lot. My
Okay.
pleasure. What's up,
Alright.
Ian?
Thank you.
So Kevin asked Corey if we could tighten up the shot a little bit.
Okay.
So in order to make sure if our next person is a wanderer, I'm gonna just like tape a little box, be like, hey, stay in this square. And to check the, what's it? Audio for the Zoom. I think it should be alright, considering the levels are still bouncing. And the power's good. So, but Corey did say Miss Wilma did sound really good compared to the first speaker, so probably just how they talked. But
Really?
yeah.
Well, working stuff out.
Yeah, simple stuff.
Sign up sheet, sign in sheet.
You know what, I don't know. Some of the people that were sitting there, I asked them to sign, but some of them may have been in the room, so I think we may have had more.
Okay.
Yeah, we're still working on the speaker stuff. Right now, they're tightening up the shot for live stream. When the speaker wanders, they wander out of camera. So I don't think they can come past that first row.
Oh.
Okay, well, I'll come down at 1:30.
I'm gonna go have lunch.
Yes, have lunch.
Just make sure that everybody knows when they come in that we're live streaming.
Okay.
Excuse me.
Hey, how we doing?
All right, how about yourself?
Good, like my purse? Isn't it
Very
good? And
stylish.
my new glasses, we're all set.
The fringe on the side there,
Yeah. The girls went to the bathroom.
Don's all by himself over there.
I'm here with all my friends. I got
Scare 'em
my
all
purse.
away?
I got my purse, so we're good.
You didn't sign in?
I will, I gotta go the rest.
How about yourself?
Good, good. We sat in on lockers this morning, so.
Oh.
Yeah.
Sign me in.
No. Sign your own self.
Dang it. Come on, you feed me, at least you can do is sign my name.
So it's like there. Getting there.
Yeah.
Lining my ducks out.
There you go. That's the trick to making it all work at this
It
point.
is, it is.
Oh, I need to turn in all my, actually, all I need, one surgery, knee back, everything. So much. Well, 7:30, isn't that what he said?
7:30.
7:30 and 45. It's crazy. It's a lot.
So this Diane, she claims she was calling on Sunday.
Yeah.
I sent her the claim form. She says, was just making sure you got my fax today. Plus, I was wondering, do I need to get a lawyer? I said, I'm not in the office today, but I asked a staff member. They said they don't see it yet. I sent it off at 6 a.m., but I will resend it if you guys don't receive it. I will just get a lawyer. I'm sorry that we didn't receive your fax. Oh, that's sorry. Yeah, whatever. Get a lawyer. Then get a lawyer, then I'm not talking to you anymore because that's how it works.
Have they asked you yet to provide labor for your assignment up here?
When I went to the bathroom, she was there. I said, so we have to remember Jenny. So she's thinking on the Thursday, December 4th, 5th, and then that following week, just one person. And then we have the 18th, and the last week of the month, two. So we'll start that.
I figured you.
Yeah. The ones I have not really don't grade it.
Well, what is it, that one guy, your old manager,
Oh, Randy.
Randy, he's a talker. He talks. Yeah.
Adrian and Christian are talkers, they're the young ones. So,
You know the guy that I like that you hired is whatchamacallit that works with Russ at night.
oh, Jerry?
Jared is the politest kid. Every time he sees me, he shakes my hand. The other day, he gave me a hug.
Yeah.
I mean, it's like he's just a nice, pleasant young man. And him and Russ seem to get along great.
They do. He always has a smile. Jared's had a rough life.
You wouldn't know it because he represents himself. That was a great hire.
Oh, I think so.
Just from what
remember
I
who
see.
sent him to me, but, yeah. And he does just about anything you can.
Yeah, we're back there doing, so can I help you? And Russ is the same way though. I mean, him and Russ are very laid back, but just, you can see they love each other.
Oh, yeah, they get along great. He's a good guy.
If getting rid of Dave got you him, it was worth it.
And who pops in my office yesterday, Dave?
Did he really? What's he want to go back to work?
Well, no, he came to the boat.
Oh, okay.
Back because he says, Mom, you might see my coming back. He said, I want to talk to you a little bit more like the HR.
Oh, yeah, that's gonna get him.
Yeah.
If you told HR about him, it would be the end.
But he's popped in a couple times and I go back there and sit in the back office. I haven't paid him from the building, but I come on.
The guy you fired.
Then I don't schedule.
Oh. So you didn't terminate him in the system? Because I know I got Donna and somebody else.
That was David.
David, and who is this?
This is David, no, Dave O'Brien, and that's David G.
Oh, okay, so you did fire David G.
Yeah.
But Dave O'Brien, okay. Is he not working the front? Who's the guy in the
That's
front?
David Leaf.
Yeah.
I can't tell them all
I
apart.
know,
David was telling me Ben with a car.
yes.
He's not his license, but he got a car.
Yeah. Matter of fact, they got 2 cars that day.
Oh, did they?
Yeah, they got one for him, on his wife, and then Ben got one. And Ben's working pretty much.
Yeah, that's what he said. I like Ben too.
Oh, I
Ben's
do.
another very polite, always talk to me. He'd come into my office to say hello.
Yes.
You know, and that, I like
There's a
that.
lot. There's some good ones out there.
You have a basic good crew.
I do.
When you have that many, there's always gonna be a couple.
Yeah.
They're just never not gonna be. But, yeah, I really like Jared. Have you met him since Stanley? You like
I
him?
haven't met him. Chuck.
Thanks, BA. That was roll. I take that back,
Whatever,
I'm
Dick
sorry.
Dingle.
Oh,
I could go on forever.
her and I could over the years. I would never call
Whatever,
you.
Stephen.
Yeah, oh, jeez. I don't know which one would be worse.
They
Keep
were
it up,
both kinda
Mark.
gross. Yeah,
Keep it up, Mark.
there's a couple of bad marks.
Yeah. Oh, yeah, that's a good point.
anybody ever hear from him?
No, he deleted me.
Right, or,
But you.
Like immediately.
Oh.
Well, I never accept Judy's
Okay, she-
request.
And they don't post a whole lot, they maybe Marcus.
I haven't talked to Mark in a while. But I got to be the fun one, the sorting out, and helping clean the office out. That was, thanks, Steve. That was, I had no issue with it because Mark and I always got along, so he didn't know what I knew and didn't know.
Yeah.
It worked out. That's why you had me do it. It was fine.
David Leaf actually friended.
I
I
liked
just,
it.
I have not accepted after, I don't know. I haven't accepted at work unless it's somebody from town.
Probably a good
in
idea.
years.
Yeah.
In years.
No, I
So it
wouldn't.
just sits there. And Kat,
Oh,
the
yeah.
merch girl, she just friended me. Like, I just pretend like I don't see it.
Is that the young girl?
She's the shorter,
Yeah.
dark
she's,
hair. She's not young.
Well, but to me, she is. Young. I know.
I was gonna say she's gotta be in her mid to late 40s.
Oh, okay. I'm not.
Isn't she the one that
She
Jimmy's
looks young from
girlfriend?
afar.
Oh, you mean,
Or did,
no, it's Tommy Garrett.
Yeah.
Yeah. That's not who I was thinking. Yeah, right. Tommy's our one that does production with Mike Sundays. He's a
Okay.
runner. Tommy's a good guy. He's
He
a
is.
really good guy.
I just,
I see. I make it easy. I don't Facebook or
Oh,
any of
you're
that
smart.
for anybody.
and you know, I dug my heels in for so many years. And my sister was like constantly, come on. Finally, I was like, all right, fine.
Roberta doesn't either. Neither one's not on Facebook, Twitter, and none of those. But we see our daughters, and that's all they do is they're staring at that phone all the time, afraid they're going to miss something or somebody. And it drives me crazy when I'm talking to her and I said, look up, look at me for a minute.
Mine is, if I'm on my phone, it's usually my email.
Yeah. Well, that's me. Email
It's
or
my work.
text is, it's most all of us.
Occasionally I'll play a game. I said occasionally I'll play a game.
Yeah, I do solitaire. That's my,
Started solitaire, it's fishy solitaire.
Oh, really?
So like you are fish.
that's fine. Yeah,
When I check in today, I'm gonna get sleepers.
all right.
It's taken a whole week.
I do Happy Color on my tablet. Color. Well, I've got a new company now I use. It's Apple something. Same thing. Because my tablet is getting a hold in like Happy Color. It just would not load it. When it did load, it would dump off and freeze up and all that stuff. I thought, well, let me try another version of another, and that one doesn't block up near as much. But I get the new tablet for Christmas. We bought it at Costco back in about a month.
Is it an iPad or is it what kind?
Well, mine's a Samsung.
Okay.
I forget what kind we bought. Probably the same little there. But what I'll do is I'll keep the tablet at work then, and I'll keep my other tablet at home. Because I bring it with me almost every day in case. I bring it, plug it into the charger, and never touch it until I go to leave. Almost all the time. I bring it in, I get a little break. You know, you see me on it, I'm just vegging out and I'm sitting there either solitaire or color, but it doesn't happen very often. Show day once in a while on a long one.
Yeah, I have a tablet, but I hardly use it.
Yeah. Because I don't want to install it on my computer. Who knows? I just rather play on the tablet or on a cell phone and forget it.
The thumb drive for us? Yeah. Wonderful. Yeah, thank you very much. Well,
I'll load up the presentation over there, or into the system. While he's doing that, it'll be the bottom file there.
So
The guy that we.
zoom in the camera a bit just to kill some of the dead space around. So if you could just like stay within the square, it should be fine.
Perfect at that. The firemen.
And back up on, so just gonna sit on that table.
On the lower level, and they're having appetizers and drink at the Memorial Center.
So what I'm gonna do is go, can you
Do have an advancer for you.
Now I'm gonna pick it there.
This is down, or forward, yeah.
Enterprise, and then go out, just take the van and move it. Because I'm leaving my pickup.
And are you kind of a wanderer, or are you playing?
No, I'll probably be in front. I'll stay in the box.
Yeah, that's perfect.
You don't have to
He
worry
picked
about
the place, he likes.
Yeah, it's just gonna sit there.
know,
It also got
you know, we're,
the like
showing
shows
us season.
for the last person perfect. So
He's working out.
Oh, yeah.
issues.
That's fine.
Yeah.
back up just for us.
Oh, yeah, I forgot that.
See, like T-20 or something.
Or so,
They had special.
If you wanna head back up, I can just share everything.
Salad, drink,
Thanks, Scott.
bread.
Hi,
Different one.
how you doing?
About 15
Good.
months.
Thanks for coming.
Yeah, always a pleasure.
I don't have a very big class today.
That's all right.
I've got
Never asked
For
13 signed up.
Okay, perfect.
but it was.
I think a few of them I've talked to very recently.
Oh, really?
There'll be some review for me.
Yeah.
It is everyone pretty much in like the last 5 to 10 years before retirement, or is it?
That I don't know. I could take a guess. I'd say 1, 2, 3.
The crisis negotiation, so.
At least half of them, maybe more.
Oh, I mean, I'm glad, cause I didn't,
Well, I mean, yeah.
Okay,
I'll basically just kind of review how the 457 and 406, some more close to retirement planning things to think about. So
Sounds good.
and Social Security and all that.
You were,
I tried to put it on here.
you tried to put it online.
Hopefully they all show up.
I don't know, you did right. I think
That's all right.
Land.
It's always good exercise anyway. So.
my personal, my one I share with Rick and Kayla.
Yeah.
Hunter. And that I can share with them.
I've written out our building calendar for, and so we always have, I have it through April right now. So I have that if I need it to come, but I don't work from home, so I'm in the building enough. I need to look at it, I can look at it. I get it.
Oh, I just tell them, okay.
All the holes are still on. What you call it? Dwight, oh, yeah, there's like 20 of
Is
them.
that confirmed? Well, it's confirmed, okay, so I need to,
It's not happening, so.
Dwight's not happening.
I
I thought he
know.
said it was almost confirmed
That's what I
yesterday at
thought.
the
Oh,
meeting.
did he? I didn't, I wasn't.
He said he confirmed my plaque,
He did say that.
that for almost confirmed.
Oh, so maybe. Well, but they're on there, like around the English, on the same day as the English game, things like that, so,
If the ambush is
yeah, it,
on there, then Dwight.
there was a few on there that could be. But good, thanks for looking at this, I was prepared for that, talking to Ian. I told Mike about it yesterday.
We need to let Mike know that it was canceled.
I'll tell him. It's not good. I told him it wouldn't affect this. But I'm glad I talked to Dan the other day, he had me get with him and show him, you know, I mean, we did talk about it.
Yeah.
but the election is over for the building for us. That's a lot of setup. Those ladies are all really nice that I work with. They know me and I know them. Some of those, set up 63, some of them all-timer judges that come down and register, they are cantankerous. They are just, exactly. They're just, yeah, so they were all bitching yesterday morning because it was humid in the building. It was a little warm. So we turned the air on, and then they would turn around and complain because it got cold. I'd say to them, I can be here. I said, you want it hot or do you want it cold? You guys got to make it. So we turned the chiller back off. We took the humidity out and turned. It was just hilarious. It's cold in August, and you know, I gotta tell them, thermostat, you know, just turn it up to the reason now. It either runs you want, but you guys were the same ones. I just and then we're just complaining. Turn the air on. Now this is cold. What do you want? Yeah. They're hilarious. And there was so many. They had 29 registered judges or to register. That's they usually have a dozen.
Yeah.
10, 12, you know, that sit at those front tables.
No, we won't have.
I don't even know if there's anything on next year's ballots.
25?
I think it's 26. It's always on the years. There shouldn't be anything next year that I know of. They haven't said nothing to me or to Tom to put dates on the calendar yet, because we had 3 this year. Because we had April, August, because you had the primary, and then you had that original one. It was just a localized one in April for St. Charles City. And then we had the national one. Anthony and his crew did a hell of a job getting that floor as quick as they did. Because we ended up using 3/4 of the floor because he had just made it. Because we moved everything that night. I said, why don't we shove everything that way and make a queue line up on that? And it worked because it did, for an hour, it was beneficial.
And then after that.
It was nothing. We could have walked. We could have taken it all down.
But we were afraid we were gonna get a rush.
Yeah, you didn't know. Yeah. Anthony was saying he was there till 9, and he said, no.
Hi.
Maybe 4 or 5.
Oh, I was gonna say, I heard something. I'm late.
No, you're not late.
Yeah, we went the week after you did,
Yeah.
and it was perfect.
Oh.
And then we were
Thank
15 minutes from the time we got into the time we were back in the car. And most of that time.
I asked a couple of times, can I go? Well, I don't know, it depends.
Oh, yeah.
We would have had room.
I guess we wouldn't know that.
Well,
Once I don't.
if you call me like right, you know, the day before, I can tell you how many are signed up, cause.
Oh, okay.
Yeah.
We'd be able to do it that way.
Yeah.
Okay. Excellent. Thank you.
Yeah.
I don't know if there's some legality they must have to put those on the ballot. That whole on the first page, that whole category on the first side was the judges that were running unopposed.
Right.
And then under the bottom, those ones there, that was that, and you turn it over and half that first column was the same thing. You want this person to take an office vote. And then none of them mean anything to me. I don't know any of them. Wonder if Amendment 2 ended up passing. It was right at, it was ahead.
The vetting?
Yeah.
No.
It failed because it was up by 2% last night.
I think I saw.
And then it balanced out in the morning. They were still up like 100-some thousand votes. Or 17,000 votes. They were still winning.
Maybe it came back, because when I saw it in the middle of the night, it was no. But it says yes, 50%.
That's where it was this morning at 5.
49.9%.
Yeah, that's where it was right there. And it was hit, I think, at that point, 73% of the votes were in, or the precincts had reported. So they both passed that. The minimum wage one did too, it passed.
It passed.
26.
It passed, I thought it was not passed. Yep, it did.
I thought they said it passed.
Great, that just means our.
Oh, yeah, it's gonna be.
We will never make money. I'm sorry.
Signing for me?
Yes. You'll come forward and see. Yeah. Again.
Thank you.
We don't give a, and we pay you for everything. So we pay.
They can afford to pay.
One position.
It's got the kitchen sink in there too? I think you do. Oh, no, it's not, that's not, it's the bathroom sink.
Nope. Okay, you have extra?
Oh, sure. I'm gonna have those in there.
Almost said that.
You'd rather eat them raw, I made them.
It's like, oh, for sure. I'm like, that was.
We buy these. Our pink bags are like.
Hi,
Hey, strawberry.
sign this for me?
How are you? Good. Before we do anything,
I do either, I have.
I need to ask you a question.
With me.
Yes, sir.
Yeah. Forget, oh,
Bikes.
oh, yeah. Got your toilet paper. During COVID.
You got me to that.
It's actually mostly for those.
I went sober that time.
I'm not supposed to how it all works, but then get into some social security.
1 year.
Yeah, ruined. Hot dogs.
That was unlimited. 60 trays of hot dogs. Okay. No.
Here we go.
2 carts full. And we didn't clean them out.
Tag there.
They believed us when we went to the register.
I go full social security, I got less than 4 years, I got 4 years.
Oh.
You just made my day.
No. So it needed 2 hours, Simone. Read it, you know, 4, 6, or 5. 2 big carts full of that house.
I don't know if I'll make it.
How many?
Good luck.
Anyway, oh, okay, great. 1. I could have been on.
You good? That's how you?
We have them all.
Yeah.
I'll retire right.
Sun's out, I'll take it.
Hi. Hi, Mrs. Is it any warmer in here now?
No. No.
I mean, woman.
Glad I jump up and down during orientation. It's so cold.
Well, it's for her, I take care of. I don't know, but it was very overwhelming, and it's not the first.
Oh, I
He was through that class, you know.
So I'm assuming.
So what?
Yeah, they've already got everything set up.
Oh, yeah, that too. That code red. Should have that one.
I like to shop with my wife.
Wanna go to like the second row or?
We do, we've just always done it.
Or some hot chocolate. Right, why did you have lunch?
I like it when we go to.
I guess I could have used my pen.
This is the first line.
Yeah. They go.
Some warmer ones.
That's the next one, I'm gonna get us a dog person. I think you're okay.
Oh, yeah, they have enough.
Yeah, for like fashion, very stout for 2 weeks. Yeah. It's not necessary.
Bert has her.
All right, well, good afternoon, everyone. My name's Dan Harden with Retirement Plan Advisors. See a lot of familiar faces in the room. Today we're going to talk a little bit about how the deferred compensation plan works, just a quick review of that, and then get into a little bit more detailed planning when it comes to things like Social Security and loggers. If you have any questions along the way, just stop me and ask me. I'd much rather take care of your question right then rather than risk you forgetting it by the time we get to the Q&A at the end. But whatever works for you, I'm happy to tackle that question when you have it. I've got this really bad habit of getting ahead of myself as well, so I might start going down a path, and then we get slides later, and it's like, oh yeah, this is what I was talking about before. So I'll apologize up front for that, but I do kind of want to make it conversational. If you have a question about it, I'd much rather just talk through it right then than wait till we get to the slide on there. So whatever works best. All right, so quick agenda. We're going to talk about some of the changes that are going to impact the plan as a result of the Secure Act 1.0 and 2.0, as well as just the regular normal annual changes on deferral limits and things like that. We'll get into, again, the nuts and bolts of how the 457 and 401A plan work. If any of you aren't actually participating in the deferred comp plan, see me afterwards. I've got the enrollment paperwork. We can get you set up right away. We want to make sure that you're taking advantage of it, not leaving the free money that the county's putting towards your retirement on the sideline. If you're not enrolled in the 457, you're basically just saying, I don't want that extra 3% of my income going towards retirement. So it's important to be in that. Also, if anyone's interested in changing their contribution amount, I've got the forms with me. We can take care of that after the presentation as well. So we can go from there. We'll get into some Social Security, when you should start taking the benefit, some tax considerations to think about as you begin that benefit, and then how loggers fits into to this as well. You'll have a few decisions to make when it comes to your loggers benefit. There we go. So the changes that are coming down the pike for the plan in 2025 mostly have to do with either contribution limits or if you're taking advantage of the catch-up contributions. So for anyone, regardless of age, the limit is increasing from $23,000 to $23,500. So that's the maximum amount the IRS says you're allowed to put into the 457 plan. Standard catch-up contribution, that's for anyone age 50 or older. That remains unchanged at $7,500 per year. New for 2025, though, is if your annual income exceeds $145,000 a year and you're making catch-up contributions, those catch-up contributions must go in on a Roth basis, meaning you have to pay tax on that money going in on the catch-up amount rather than deferring the tax on it. The regular contribution limit, that first $23,500, that can be pre-tax or Roth, and I'll get into the difference of that in just a second. But any additional amounts you're putting in and your income over that limit, you have to do Roth contributions. There's also a new catch-up provision. So if you are age 60 to 63, and the IRS definition is the year that you reach that age. So if you turn 60 on December 15th, that's the first year, even though you're 59 for most of that year. But the years that you reach age 60 through 63, you can do an additional catch-up contribution. You can do 150% of the standard amount. So that means instead of the $7,500 a year, you can do $11,250. So as you get towards the end of your career, if you really want to turbocharge your contributions, you have a few more avenues that you can do that. When we get into the loggers and the end of career planning decisions, that can be a really big tool in the toolbox. For instance, if you have a full PTO bank and you're going to get that paid out, that can actually be deferred into the 457, so you don't have a big tax bill on that payout. So the increase on the limit here gives you a little bit more flexibility on that. Any questions on kind of those limit changes that are taking place next year? All right. So then let's just kind of review how the deferred compensation plan works. I see a couple new faces in here. There are two separate accounts. Your contributions always go into the 457B plan. Any money that the county contributes always goes into the 401A plan. You don't put money into the 401A. And the reason for that is the IRS gets a little funky when it comes to government plans. If the county was putting money into the 457 along with you, well then however much they put in counts against those limits we were just looking at on the previous slide. So to get around that, employer contributions or county contributions just go into a separate account, and that's not going to limit how much you're able to put into the 457. So that's why there are two different accounts. For all intents and purposes though, it's one account for you. When you get your statement from Nationwide, it's one account number. They do break it out, 457B, 401A. If you really wanted to have a different investment strategy on one versus the other, or different beneficiaries on one versus the other, you can do that, but that kind of adds an extra layer of complexity in there. We don't usually recommend that you do that, but because they are separate accounts, you can do that. So when we talk about those new limits, that means if you're 50 or older, you can do $31,000 a year into the plan. If you're under 50, it's the $23,500. If you're age 60 to 63, the total amount you can put in is $34,500. The county's going to put up to 4% of your pay into the 401A, depending on how long you've been here. So basically, every 6 years of time that you've been here, they increase the match a quarter of a point up to that 4%. So you start out at 3%. On your 6th anniversary, you're at 3.25. On your 12th anniversary, at 3.5. And so it just gradually increases the match just a little bit. The very first contribution you get from the county, if you haven't enrolled yet, they're going to put $300 in to get you started. That's not part of a match, that's just kind of seed money on that. And then they start the matching contribution after you've finished your 6 months. So if any of you are new to the county, you haven't been here 6 months yet, you can get started in the deferred compensation plan now. As soon as you get past that 6-month time period, then the match contribution starts going into that 401A. All right, any questions on eligibility there? So again, just kind of a quick review there on the differences between the two accounts. When you put money into a retirement plan, you have a choice as to how you do that, so it impacts your taxes. A lot of times, the most common way people are saving for retirement are pre-tax contributions. Sometimes they're called traditional contributions. And that's when you put money in. Every dollar you put towards retirement this year comes off your taxable income this year. So that results in you paying less tax this year. That money is going to grow tax deferred along with all the earnings that investment generates. And then when you get to retirement, you start taking money out of the bucket. It's treated as taxable income then. So it's going to be taxed the same way then as your paycheck is taxed now. And the amount of tax that you pay is all based on what your household income is. So, you know, the higher the household income is, the higher the marginal tax rate is gonna be on that. Roth contributions allow you to do that kind of in reverse. So if you would rather pay the tax today on the money that you're saving for retirement, you can do that. And then that, the earnings that generates are gonna stay tax deferred, meaning you're not paying tax as those investments generate interest and dividends and things like that. And then when you get to retirement, provided it's been at least 5 years since your first Roth contribution, and you're at least age 59 and a half at that point, then the entire account gets to be tax-free. So not only what you put in, but the earnings that it's generated along the way. So sometimes that's a great option, especially if you're at the beginning of your career, or if you have the child tax credit. Right now, you get $2,000 per child you get to claim on your tax return under age 17. So oftentimes your tax burden is lower in that situation than it'll be when you get to retirement. And that makes you a good candidate for a Roth contribution where you pay the tax up front, let it grow tax-free, and then when you get to retirement, you got a bucket of money you don't have to pay taxes on. That'll also give you some more flexibility in retirement as well, because loggers, every dollar you get out of logger is gonna be taxed the same way your paycheck is taxed. Every dollar you pull out of the 401A, the account that the county's putting money into, you're gonna pay tax on that, just like your paycheck. Up to 85% of your Social Security benefit is taxable income as well. And we'll get into that a little bit later. But having a bucket of money that you don't have to pay taxes on will give you a lot more flexibility in how you pay your taxes in retirement as well. So if you haven't met with us in a while, we always recommend touching base with us every year or two, just to make sure that we're on the right track. One of the exercises we go through every time we sit down with you is, hey, what's your household income look like this year? What's your tax status? Any dependents still in the house? And we'll kind of give you a recommendation as to whether or not you should be making pre-tax or Roth contributions. At the end of the day, my crystal ball's busted. I don't know what tax rates are gonna look like, 3 years from now, let alone 30 years from now. But we can come up with a pretty good strategy for you to help mitigate some of those taxes. Any questions on pre-tax versus Roth? I love it when I explain it so well the first time that we don't have questions, but if they come up, please let me know. All right, so I always like to just kind of throw out some examples here so you can kind of see why it's important to be participating in the deferred comp plan. So I'm going to start with my assumptions. We got a new hiree starting at $45,000 a year. Let's say they're 35 years old now. They're going to work here for 25 years, retire at 60. That's full retirement age for loggers purposes. Unless you're law enforcement, which is age 55, but for the rest of us, it's 60 before you can start drawing that full loggers benefit. So over a 25-year period, get an average of a 2% raise and an average of 7% market return. Now we know the market doesn't work like a straight line. Some years you're gonna get 20%, other years you may lose 20%, but the long-term average for stocks is up about 8 to 9% per year. And the market tends to be higher 3 out of every 4 years. When we look at the last 100 years, there have been 74 positive instances or positive calendar years and 26 negative calendar years. So it's going to be positive more often than not. So $52,850 represents the total amount that this employee contributed over their 25 years with the county. Only doing the 3% contribution, which comes out to a little less than $52 a paycheck based on that starting wage. $105,700, that's the total amount of money that went into the bucket between what the employee did and what the county did. So that's 100% return on investment right there. And we haven't even talked about the market return. If you're not taking advantage of the county match, you're giving up a guaranteed risk-free immediate 100% return on your money. You don't want to do that. $265,783, that is the compounded growth of the account after 25 years. So $105,000 went into the bucket. At the end of the day, you got almost, a little over $265,000 in the bucket to use however you need. With this, you take as much or as little as you need when you need it. Unlike loggers, which is based on a formula, you can't call them up and say, I need to buy a new car or take the grandkids to Disney, send me more money next month. They're not gonna do that. That's what this $265,000 here is for. 1281, that's the monthly amount of income that $265,000 would generate if you were taking the same dollar amount out each and every month. And that comes out to about 20% income replacement based off of the assumptions that we have here. If instead of a 3% contribution, you had a 7% contribution going in, which is about $120 a paycheck based on that starting income, then instead of $265,000 in the bucket, it's over $400,000, and that's gonna generate just under $2,000 a month in income, or about a third of the income replacement. So that can be a pretty substantial amount of the retirement income that you could have in retirement. So when it comes to planning for retirement, how do we make all these pieces work? It's really about identifying that primary income stream. That's gonna be the mailbox money, Social Security and loggers. Doesn't matter what the market's doing, you got that money coming in, it's pretty much guaranteed. If that's enough to cover everything, great, you're in really good shape. Now that 457 bucket really is just for going to Disney and buying new cars and things like that. If there's a little bit of a gap, well, then that's gonna be what your savings fills up. So it can be the retirement plan here. If you've got traditional or Roth IRAs outside of the county plan, that all counts. So any buckets of money you've accumulated along the way, that's gonna fill the income gap that Social Security and loggers may not fully cover. So as long as there's enough in those buckets to fill that gap, then again, that's gonna meet the definition of a successful retirement there. All right. So let's talk a little bit about Social Security. What's the earliest age you can start drawing that benefit? It's on the screen. 62, right. So what's full retirement age for loggers? 60, right. Full retirement age for Social Security is 67. Kind of a trick question there. But for loggers, it's 60. So if the plan is to retire at 60, you're on that Social Security at 62, but you got a 2-year gap that you're not getting that income. So that's where your bucket is going to fill that gap potentially for a couple of years. But does taking the benefit at 62 make the most sense? Well, it kind of depends on your specific situation. I'll show you why it may not here in just a second, but if you started drawing that benefit at 62, you'd get about 2/3 of what you would have gotten had you waited until your full retirement age, which is 67. If you were born in 1960 or later, your full retirement age is 67. If you were born before 1960, it's sometime between age 66 and 67. And it's about an 8% adjustment. So the earlier you start that benefit, you're giving up about 8% per year, and with the compounding effects, that's how we end up with 2/3 of your income or your Social Security benefit at 66 versus age 67. So that's different from loggers a little bit. With loggers, you can take an early benefit, and you do have a reduction in benefits by taking it early. It's 0.5% for every month prior to your age or your 60th birthday. So in that regard, it's kind of similar to Social Security. If you're taking it early, you're giving something up. But on the flip side, with Social Security, you can delay taking that benefit past your full retirement age, all the way out to age 70, and you get an increase in what that benefit's gonna look like. So at age 70, you get 125% of what you would have gotten at age 67. That's where it's different from loggers. You don't get any benefit for waiting on drawing your loggers benefit after you've already retired. So, and the way that the loggers benefit works here with the county, if you don't start your benefit right away, you lose the little bit of a bridge that they give you. So it's the 2% multiplier until age 65 and then only 1.5% afterwards, but you gotta start that right away. If you delay your loggers benefit, it's just the 1.5% all the way. Okay, so your Social Security benefit is gonna be less if you take it prior to full retirement age, and more if you take it after full retirement age. So then the question becomes, well, when should I take it? And if we knew how much time we had on Earth between us and our spouse, it would be a super easy question. It's just math at that point. But the thing is, we don't know, and there are a lot of contingencies out there, right? So the chart that's up here now kind of shows the difference in benefits that you would get based off of different starting ages and different times of passing. So the column down the left, that's the start age from 62 to 70, and the row across the top, that's the age at which you pass away. So if you started your benefit at 70 and you died at 70, well, guess what? There's no Social Security benefit for you, but there could be a spousal benefit. We'll get into that in just a second. On the flip side, if you started your benefit at 62 and you passed at 70, well, you got as much as you possibly could have if you left the planet at 70, right? But the thing is, we don't know at that time. It's about, the break-even age is about age 82, 83. If you look at that 80 column there, the numbers are all pretty similar. So 324,000 cumulative benefits from 62 to 80, 332 from 64 to 80, all the way down to 316 from 70 to 80. And then as we move to 85, the longer the longer you waited to start that benefit, the higher the cumulative benefits were at every age. So it's about age 82, 83 where that break even comes into play there. If you live all the way out to 90, well, you can see that you made a mistake if you started that benefit at 62 versus waiting until 70. It's almost $135 or $130,000 difference between that there. So we kind of half-heartedly joke around that if you start your benefit at 70 and you pass away at 75 or 80, well, you don't know you messed up because you're not around anymore. But if you started that benefit at 62 and you live till 90 or 95, well, then you know you messed up all the way to that point there. So delaying that retirement benefit can have a pretty big impact on the overall retirement success. Some other reasons why you may consider delaying that benefit, because when I talk to people about that break-even age being about 82 and 83, more than half the time the response is, there's no way I'm going to live to be 82. You'd be really surprised. If you're a male age 65, it's a coin flip. You got a 50% chance of living to 87. Now, you got to get to 65 in the first place. A lot of folks don't. But if you made it to 65, it's coin flip, one way or the other. 25% chance that you'll live till 93. Odds are even longer if you're female. A female age 65 has a coin flip chance of living to 89 and a 25% chance of living to 96. For a couple that are both age 65, at least one person surviving, there's a 50% chance of at least one of them surviving to 93. So these are some seriously long ages there. And with that Social Security increase by delaying, it's kind of important to at least factor that in as part of the retirement income versus just assuming that you're going to take the benefit at 62. Now, another reason why it's important to delay, especially if there's either an age disparity or an income disparity between a couple, when one spouse passes away, the survivor gets the higher of the two benefits. So even if, say the male spouse is the higher earner, but maybe has some health issues and isn't expecting to make it past 85. Well, if there's a big disparity in the income, especially if that spouse is older than his wife, well, he might want to wait until 70 to provide that guaranteed income for his spouse after he passes. Those are kind of some of the planning things that we want to address before you actually make the decision on drawing that benefit. One way to optimize benefits is for the lower earning spouse to start that benefit at 62, just to get some of the income in. And then the higher earning spouse delaying until 70, and that can, again, provide some higher guaranteed income for the survivor, regardless of which one's the survivor, because one of the Social Security benefits is going away. You don't get to keep both of them when one spouse passes. If the lower earning spouse passes away, well, it's the lower payment that goes away. If the higher earning spouse passes away, then the higher Social Security check stays and the lower Social Security check goes away. If you're continuing to work while drawing Social Security benefit, that's something you also have to keep in mind there as well. So if you're working part-time somewhere and you're making more than $22,000 a year, it may not make sense to start drawing that Social Security benefit at that time because you're gonna lose $1 of benefit for every $2 over that $22,000 number that you earn until you reach full retirement age. And the year you reach full retirement age, they kind of give you a little bit more of a buffer in there. But ultimately, if you're earning a paycheck somewhere else and you don't need the Social Security benefit, it's generally better to delay starting it until you're done working part-time or you reach that full retirement age so you don't have a reduction in benefits. Now, at the end of the day, because you're still paying into Social Security while you're working part-time and getting your benefit, they do readjust it when you reach age 67. But it's one of those things where we want to really kind of crunch the numbers for you, see if it makes sense to start drawing that benefit. Another reason that delaying Social Security benefits is important is we all know that there's a cost of living benefit associated with Social Security, right? But it changes every year based on what inflation was the prior year. So does anyone know what the Social Security increase for next year is going to be? Just came out last week, I think, maybe a couple weeks ago. So the CPI increase is 2.5%. So anyone who's collecting a Social Security check right now will get a 2.5% raise over what they had last year. Now, a couple years ago when inflation was 9%, did they get a 9% increase on Social Security? No, they got a 5.4% increase on Social Security. So the cost of living adjustments very rarely actually keep up with inflation, but there is some sort of cost of living adjustment. By delaying your benefit, getting a bigger base, well, you're getting a bigger absolute dollar increase every year as well. So even though it's a meager 2.5% in 2025, if your Social Security benefit is $1,500 a month at 62, or it could have been $3,000 if you waited till 70, well, that 2.5% on 3,000 is twice as much as 2.5% on 1,500 would be. So it can increase the absolute dollar amount coming into the household, and it's cumulative. It does have a compounding effect on there as well. Perhaps more importantly, though, by delaying by getting a bigger Social Security benefit, part of that Social Security payment you get is tax-free. Whereas every dollar you get out of loggers is taxable, or at least 15%, and potentially more depending on what your household income is. At least 15% of that Social Security benefit is tax-free. So that means a dollar that you get from Social Security is worth more than a dollar you get from loggers or out of your IRA or your 401A bucket, because you got to pay tax on every dollar that comes out of that, whereas you only have to pay potentially up to 85%, or have 85% of that Social Security benefit included in taxable income. So the more of your monthly expenses that can be paid for by Social Security, the less tax you're going to have, which means the slower you're going to be drawing down your other retirement buckets later on. So there is some tax optimization by having a larger Social Security benefit as well. So that was a lot. Any questions you guys have on that? Yes, sir.
Social Security, if I decide at 70, that's when I'm taking it. How many hours or how much can I make at 70 still claim full Social Security?
Yep. So actually, any point from 67 or beyond, there's no reduction in Social Security benefits. If you're still working full-time, you can start taking that benefit at 67, you're not going to have a reduction. It still may make sense to delay till 70, just for the reasons we're talking about here. There is no benefit to delaying past 70. If you're 72 and you haven't started your Social Security benefit yet, you need to call them and they'll give you the back pay on that. But yeah, there's no reason to delay past 70. Good question. Any others? All right, so let's talk then a little bit about loggers. Now, this is probably a review from this morning's session. I like to say when it comes to loggers, my colleagues and I at RPA know almost as much as they do. We probably know more about loggers than anyone that doesn't get a paycheck from loggers. So we're happy to be a resource for you on that benefit as well. Of course, use the resources that you have from loggers as well. But there are some decisions that you'll have to make, especially the last few months before retirement, that really do have a big impact on what your loggers benefit's gonna be. So just to recap, loggers is all formula driven. It's a multiplier times your years of service times your final average wage. The two things that you kind of have, or the one thing you have control over is the years of service, I guess, right? You can decide to work another year or not, but every year that you work adds a year into that formula. The multiplier, that's kind of set by the county. The final average wage, though, is unique here with the county. If you have a PTO balance accumulated, you can elect to have that paid out to you over your final 4 pay periods rather than getting it all at once on your last paycheck. Loggers does not consider a PTO balance paid out on your last paycheck as part of your wage. It's just a benefit that's paid to you. If it's paid out to you over your final 4 pay periods, though, it is included in your final average wage. So if you've accumulated that time and you're just planning on getting it cashed out to you, talk to HR, they'll tell you how much it is, what the last 4 pay periods it'll be paid on, and that will affect your final average wage, which will impact your income for the rest of your life. So it's important to take advantage of that benefit. So you got a couple decisions to, oh, yes, sir.
Is there a limit on that?
So I think you're limited as to how many hours you can have, right? 400 and so odd hours in the bank. But if you've got that bank full, no, you can split it over your last 4 pay periods. That'll give you the higher average or the higher wage on the 3rd year of the calculation. So that final average year is the highest consecutive 3 years out of the last 10. So no, I mean, if you have enough PTO banked up that it's gonna pay you, say, 40% of your annual salary, yeah, that last year is gonna look a lot bigger than the other 2 years in that average. So, yep, good question. So there are a couple of decisions that you have to make when choosing your benefits, and they're irrevocable, right? You get one shot at them, and after you make that decision, that's what it is. You can't go back to loggers and say, oh, I want to redo. Unless you choose one of the beneficiary options and your spouse passes away, they do allow you to get the higher benefit after your spouse passes away, but that's not exactly the same as making a decision up front. So the 2 decisions you have to make are, do you take the partial lump sum? If you take the upfront lump sum, basically what that's gonna be is 2 years worth of your regular, not the temporary that you get from 60 to 65, but the regular payment that you get from 65 for the rest of your life. You get 2 years of whatever that payment's gonna be upfront. In exchange for that, you're giving up 16% of your benefit for the rest of your life. Right, so it's a way to front load some of those benefits. You can do whatever you want with that money afterwards. You know, you can go on vacation, go buy a car, pay off some debt. It's all taxable income, so you could expect to have a pretty hefty tax bill. If you're gonna go that way, we usually recommend that you retire at the end of a year so that you're getting that lump sum in January or February and starting the new tax year, not taking all of that money up front or on top of what your W-2 wages were. When you choose the lump sum option, it takes them at least 90 days to get that out to you though, so there's some things to consider there. You don't have to take that lump sum in cash though, you can defer that into the 457 plan. And when you roll it to a retirement account, whether it be the 457 plan or a traditional IRA, that's not a taxable event. You're able to defer the taxes on that. And that's treated as a rollover rather than a contribution, so it doesn't matter how much the lump sum, or yeah, the lump sum payout is. that doesn't count towards those contribution limits we were looking at before. Right, so if you've got a 60, let's say your partial lump sum payment's $85,000, you can take that whole 85 and put it into 457 because that's a rollover, that's not a contribution. The other decision you have to make is what beneficiary option, if any, you want to choose. And you can do this in conjunction with the lump sum payment as well. So if you want to protect your spouse at 75%, meaning if you were to pass away, your spouse would get 75% of whatever benefit you were getting, you can do that and take the lump sum as well. It's just the reductions that we're talking about here are cumulative. So, you know, if you're only getting 84% of your benefit because you took the lump sum, and then you're only gonna get 85% of that 84% benefit because you're covering your spouse at 75%. The math's kind of hard there, but I think it's about 67, 68%. You're getting 2/3 of what your benefit would be if you just took the straight life option with loggers. So there are some things that you want to really crunch the numbers on, make sure that everything works there. On the beneficiary options as well, in addition to the 75% spousal benefit, there's also a 50% spousal benefit that's going to preserve a little bit more of your income while you're still here with us, but after you pass, your spouse doesn't get as much. There's also a 10-year guaranteed benefit. You can choose someone other than a spouse to be the beneficiary on that. You give up about 5% of your benefit for that, but if you were to pass away within 10 years of retirement, that person that you name is going to continue to get a benefit until the 10th anniversary of retirement. After that period, the benefit goes away. On the spousal options, there is an age adjustment. If there's a significant difference in ages between you and your spouse, if your spouse is younger than you, you're going to be giving up more of your benefit because your spouse is going to be protected for a longer period of time. If your spouse is older than you, it's not going to cost quite as much as what the numbers up there are saying. And when you elect that from loggers, you have to send in your spouse's birth certificate. They do the actuarial numbers. They'll tell you exactly what the cost of each of those options are based on your specific numbers rather than an estimate. As you turn in that final paperwork to them, they'll run that. All right, any questions on that? Again, like I said, this is kind of review from this morning's session there, but it is important to kind of understand it. Yes?
So the two spouse options, let's say I'm unmarried, everything goes to my sister.
Yep.
Do those reductions also apply there too?
So option A and option B are only available for a spouse.
Okay.
Or if you have a special needs child who's at least age 40. You can have those benefits as well. But otherwise, any other situation, a non-spouse has to be option C. If you were to pass away 11 years after retirement, that beneficiary would not get any payment. If you were to pass away 3 years after retirement, they would get the payment for the remaining 7 years, kind of thing. Great question, thank you. Any others? All right, so going back to that PTO balance again, you can defer that amount into the 457 as well to avoid having a big tax bill or tax surprise. The difference between the logger's lump sum payment going into the 457 and your PTO payout going into the 457, PTO is a contribution. It's not a rollover. You haven't been taxed on that money yet. So that's where those limits we were looking at way back at the beginning of the presentation come into play. So 31,000 if you're under 60, between 50 and 60, or the 33,250 if you're over between ages 60 and 63 on there. Interestingly enough, the year you turn 64, you can't do that new special catch-up contribution anymore. It goes back to the standard $7,500 catch-up. But by having those increased limits there, it does give us a lot of room where we can defer that into the retirement account so you don't have to pay tax on that PTO balance or a portion of that PTO balance. In that regard, sometimes it makes sense to set your retirement date in maybe late February, early March kind of situation. Because if you're getting that PTO balance and you've already maxed out your contribution for the prior year, well, the clock restarts on January 1. You get that full $31,000 available on January 1. So you can still get a full year's worth of contributions in, even if you're retiring in February or March. The thing is, we have to have 4 pay periods in order to get that in. So if you set your retirement date as, say, January 15th, there might only be 1 pay period in that new year. We'd only be able to get a quarter of that PTO amount into the tax deferred account. Does that make sense? Awesome. I like seeing more Bobs than okay. So again, just to kind of recap what the deferred compensation plan really can do for you. It's designed to be a supplement to your Social Security and your loggers. You can't call them up and say, send me more money. I'm gonna buy a car. You got to pay for that car out of your savings along the way. A lot of times it makes sense to use the money in that bucket to cover your expenses while you're waiting for that higher Social Security benefit. You know, if it does make sense in your situation, you're retiring at 60, it makes more sense to delay the Social Security till 65, 67, whatever the optimal age is. If you got enough money in the bucket to support your lifestyle, well, yeah, let's do that on the front end, and then get the higher guaranteed Social Security amount, which is going to give us a more advantageous tax situation down the line as well. Because another thing that you're going to have with any money you haven't paid taxes on yet, the year you turn 75, you got required minimum distributions. You got to take money out of those buckets whether you need to or not. That can sometimes push you into a higher tax situation. If you took money out of that bucket earlier on, that means we got less in the bucket that's going to be subjected to those required minimum distributions down the line. So that can help mitigate some tax headache down the line. By the way, the required minimum distribution age has changed a few times over the last couple of years. I saw some eyebrows raised when I said 75. It used to be 70 and a half, then it got changed to 72, then it got changed to 73, and then it got changed to 75 for anyone who's not already 65. So again, they love making things super easy for us, right? No, it's kind of a convoluted definition there. But if you're not 65 yet or weren't 65, I guess last year or at the end of 2022 when the law was passed, then your RMD age is 75. If you were already 65 at that point, then it's 73. So for the next 10 years, financial advisors are going to have a great time trying to remember which RMD age you have to take money out. The other thing that the retirement savings is important for, we talked a little bit about cost of living adjustments. Social Security, 2.5% this coming year. It was 5.4 when inflation was 9%. Who knows what the maximum loggers cost of living adjustment is? 4%. Doesn't matter what inflation is. By law, it's only going to be 4%. Now, their intention is the year after to try and make up for it if they can, but they're not under any obligation to actually do so, and it kind of depends on what the underlying investment portfolio is doing there. Stocks historically have been the best inflation mitigation. So if you've got a bucket of money that you're investing, that's going to be your cost of living adjustments going forward when the actual cost of living adjustments you have on your mailbox money isn't actually keeping up with inflation. We know there's volatility in your investments. It's important still to have some risk exposure in there though. If you're just in the fixed account and you're only getting 2% on that, well, guess what? You're still losing money because of inflation. Stocks, they're going to go up and down, but more often than not, they're going to be positive. And when you sit down and talk with us and come up with an actual distribution strategy on that money, we're going to identify how much money you need to take out in, say, the next 5 to 7 years. We'll put that in the fixed account. Everything else really should be invested for growth at that point. And then when you're taking money out, If the market's up, we can take it from the stock side of things. If the market's down, we've got enough in the buffer that we can take it without having to sell your stocks at a loss. So when it comes to that allocation, by all means, come take advantage of the benefit that the county gives you in us. We give you the financial advice, the investment recommendations. We are fiduciaries and there's no cost to you for us to review those investments. All right, so if you have any questions, always happy to tackle those. I know, like I mentioned before, I've seen a lot of you in one-on-one meetings before. We do get into this building every single month to do review and enrollment meetings. Our office is out at Mid Rivers and 70. We'd love to have you visit there for a review meeting. If a phone call or a Zoom meeting works better for you, we can absolutely do that as well. If you ever have any issues with your Nationwide account, give us a call first. Oftentimes, we can answer your question without you having to wait on hold with Nationwide. They're pretty good. They answer the phone fairly quickly, but sometimes you do have to wait on hold. So give us a buzz. If we can resolve your question, we're more than happy to do it. If it's something that there is a hold at Nationwide, we're more than happy to do that and conference you back in once we get someone on the line. There's a QR code on the slide up there. If you want to schedule a meeting, that brings up our online scheduling tool. I also have business cards. You can use the QR code to schedule a meeting that way. Or if you prefer to talk with one of our admins, you can give us a call and they can get you on my calendar as well. But certainly would be interested in sitting and talking with you and making sure everything's working. All right, so any questions before we wrap it up? All right, well, I hope this was helpful for you. I appreciate you guys coming in and the good questions during the presentation. It's always good to have a more interactive presentation there. Wish you guys all the best. Oh.
I do have a question. Once you decide that you're gonna do the 4 payments out of your PTO?
Yeah.
How can you what do you need to do to have that put into the 457?
Yeah, excellent question. So really that's just a matter of changing your contribution amount for those 4 pay periods. This is the simple form that the finance uses to change your deferral amount. So once you get that amount from HR and they tell you what date that's gonna start on, we just fill a new one of these out. We can put that date as the beginning date on here and we can turn it into finance. As long as we give them enough lead time, they can get it processed. But if it's gonna be on the next pay period, there may not be enough time to get that switched in the payroll system. Should be, but just if communication's off by even a little bit, we could miss that. So we usually recommend, as soon as you have those numbers, reach out to our office. We can fill a new one of these out for you, have you sign it. We send these to finance each and every day because we work with a lot of county participants. Excellent question. Any others? If anyone wants to make a change to the deferral amount, like I said, I've got the forms here. If anyone has a question they didn't want to ask in front of the group, I'm happy to take those. I'll probably head back next to my laptop there. If anyone needs me to look something up for them really quickly, I'm happy to do that.
What's the office hours?
8 a.m. to 5 p.m. Monday through Thursday and 4:30 on Friday. So we close a little bit earlier on Friday afternoon. But we come on site, so we do not only come to this building every month, but we are at a lot of the departments throughout the county several times per year as well. Awesome. Well, again, thank you much. You guys have a great day. Yeah, you put whatever amount of it you want.
Yeah. You do. Thank you, Dan.
You can't retire. There we go.
What are you thinking?
I can't, I know I can't.
Do it anyway.
I was dancing there for a minute.
You were.
Yep.
Didn't too long.
Unfortunately.
Okay. Yes.
Okay.
We have in the Roth tax bucket, we don't have to. It's just a matter of changing your contribution.
So if I wanted to, I currently have, is that something that can be done? Or is that
And it does count as taxable income.
I'm not sorry.
I know that, I have,
Medicare.
outside, county as well, I'm not in a process.
Yeah.
So I'm trying, just as an
Well, that's
example.
what I mean.
That's a large amount out, cause I just bought a new
Between-
so instead of paying 11% or whatever.
Well, I get it.
I took it out and it was $10.
Eat the
So that was absolutely.
Medicare.
So that was my question is if I have it, I roll it into a Roth with you guys?
Yep.
Or is there an?
No,
it wasn't. Would it be called rolling or would it
What we
be
sign up
a certain amount?
His money's made.
So that's called a conversion.
Whatever, he's licensed to sell
Yeah.
their insurance. He gets the same, whether he calls me Humana or so that's what we,
How
rate of
gets added on.
Right.
So we would kind of want to.
He's still.
advise us what to do.
He's never gonna change.
Keep her on.
Have a
Good seeing you.
Move her to Medicare.
It could make more sense to actually
With the same coverage, it's better to move her.
at that point
We did it.
taxable income.
And he did all that, and never cost us a penny.
But those are the things that we'll kind of review with you, just to see what makes the most sense.
Alrighty, sounds good. Thank you so much.
Yes, sir.
Yeah, July, your laptop.
Yep, it's right back in. Yep.
You guys have 10 minutes. I do. I just wanna see where I'm at, and if I need to, well, I can advance, I wanna add a little bit more if I can.
Okay.
Because, like I said, I just turned 63 a couple weeks ago.
Happy belated birthday.
Thanks, but I was a little confused, not confused, I didn't know about this contribution, catch-up contribution, I don't even know what that actually was.
Yeah, so the standard catch-up contributions, the 7,500, the new one going into effect in 2025. Because you'll turn 64 in 2025.
Yes, it will be.
So, yeah, that's not gonna help us too much.
That's all right. I'll let you know my name when you're ready.
Oh, you made it easy, it was on your,
Yeah, badge.
just have to get out of the house.
Oh, okay. Yeah, I normally stop and see Jim.
Yeah.
But I haven't had a chance, I wait for you guys when you come here. I hadn't seen when you guys have been coming in, it's like, are they ever gonna come in? Well, they come in, but I never get the opportunity.
I'm actually in next week.
Are you able to get in to our Wi-Fi system here? It'd be a miracle.
Yeah, I usually try my hotspot, but I'm not getting much of a signal here.
If not, I'll make an appointment though, I have to, no big deal.
Try to get some here.
Yeah, my last update was with you, probably a couple years ago. We changed something, we were going in a foreign currency or something like that, I don't remember exactly what it was.
Okay. Probably just diversifying the investments a little bit. Keith, right?
Excuse me, I'm very tired. I was up last night watching
Yeah,
the election and didn't.
I stayed up until just under midnight, and then I went to bed.
That's me.
Yeah.
But she laid there with the light on, the TV going, and it's like, yeah.
And my 16-year-old, on Wednesdays, they don't start school until 10:30 or 11, something like that, and he's driving now, so, yeah. He's like,